Good morning. Happy Sunday. Thank you for being here. We want to give you an update on where we are and some suggested actions going forward. The numbers are still going up. As we've discussed, we watch the other countries. You see that trajectory and trying to turn the trajectory. But as of now, the numbers are continuing to increase. What we're working very hard to do is to keep the rate of increase of the spread of the disease to a level that we can manage it in our hospital system. We have 53,000 hospital beds available. Right now, the curve suggests we could need 110,000 hospital beds, and that is an obvious problem, and that's what we're dealing with. You have the nation's role in this situation. You also have the state's role. This is what they call an emergency management situation, and there are rules for emergency management, who does what. Basically, the state governments, local governments, manage an emergency unless the emergency overwhelms the capacity of the local government. And then the higher level of government takes over. That happens even on the state level. A city will be in charge, a county will be in charge, unless it overwhelms their capacity, and then the state comes in and takes over. The federal government has made a decision to leave the states in charge of deciding quarantine procedures, whether to open, whether to close. That's why you see New York taking certain actions, Illinois taking certain actions, different states taking certain actions, because the federal government thus far has said different situations in different states, let the states decide dependent upon the number of cases they have. And I think that has been right to date. That could change, but it's been right to date. However, the federal government should nationalize medical supply acquisition. The states simply cannot manage it. This state cannot manage it. States all across the country can't manage it. Certainly the states that are dealing with the highest caseload can't handle it. But you're hearing it all across the country from states. They just can't deal with finding the medical supplies that they need. And that's why I believe the federal government should take over that function of contracting and acquiring all the medical supplies that we need. Currently, when states are doing it, we are competing against other states. In some ways, we're savaging other states. I'm trying to buy masks. I'm competing with California and Illinois and Florida. And that's not the way it should be, frankly. Price gouging is a tremendous problem, and it's only getting worse. There are masks that we were paying 85 cents for. We're now paying $7. Why? Because I'm competing against every other state, and in some cases against other countries around the world. Ventilators, which are the most precious piece of equipment for this situation, they range in price from $16,000 to $40,000 each, and New York State needs 30,000 ventilators. This is just an impossible situation to manage. If we don't get the equipment, we can lose lives that we could have otherwise saved if we had the right equipment. The federal government has two options to handle this. Voluntary partnership with companies, where the federal government says to companies, I would appreciate it if you would work with us and do this. And the president has done that, and he seems to have gotten a good response on a voluntary basis. The other way is what's called the Defense Production Act, where the federal government has the legal authority to say to companies, you must produce this now. It is invoking a federal law. It is mandating that private companies do something, but I think it is appropriate. If I had the power, I would do it in New York State because the situation is that critical. I think the federal government should order factories to manufacture masks, gowns, ventilators, the essential medical equipment that's going to make the difference between life and death. It's not hard to make a mask or PPE equipment or a gown, but you need companies to do it. We have apparel companies that can make clothing. Well, then you can make a surgical gown and you can make a mask, but they have to be ordered to do it. If the federal government does it, then they can do it in a very orderly way. They can decide how many they need. They can designate how many each factory should produce, and then they could distribute those goods by need rather than having these states all compete against each other. It would also be less expensive because it would avoid the price gouging that is now happening in this marketplace. I can tell what's happening. I'll contract with a company for 1,000 masks. They'll call back 20 minutes later and say the price just went up because they had a better offer. And I understand that. Other states who are desperate for these goods literally offer more money than we were paying. And it's just a race that's raising prices higher and higher. We even have hospitals competing against other hospitals. If the federal government came in, used the Defense Production Act, you could resolve all of that immediately. Also, we need the product now. We have cries from hospitals around the state. I've spoken to other governors around the country. They have the same situation. They need these materials now. And only the federal government can make that happen. So I believe the federal government should immediately utilize the Defense Production Act, implement it immediately. Let's get those medical supplies running, and let's get them moving as quickly as possible. In terms of federal government funding, they should prioritize the funding. Individuals need money. You're laid off. You're going paycheck to paycheck. We took care of the rent issue here in New York, the mortgage payment, but you have to buy food. You have to buy essentials. And if you haven't worked and you're laid off, you're in trouble. So I think the federal government is exactly right. The president has talked about this. Get funding into the pockets of families that need it to live. Second, money to governments. I'm spending money right now that we don't have. I'm not going to deprive people of medical services, but the economy has stopped. People are not paying their taxes. If you're not paying your taxes, that's a state source of revenue. So funding from the federal government is essential for me. And third, the corporate subsidies that the president is talking about, I think is also right. But the corporate funding should not be a gift to corporations at the taxpayer's expense. Let's learn from what happened in 2008. I was Attorney General at that time in the state of New York, where we bailed out corporations. They bought back stock. They paid their corporate executives handsomely. They benefited from taxpayer money, and the taxpayers wound up getting none of the profits. The citizens should benefit from the corporate success. If the government takes equity, if the government charges an interest rate, but this time, if the taxpayers are going to bail out these big corporations, make sure the taxpayers share in the success of these corporations. Let's do it right this time. Also, the federal funding, they're working on another coronavirus bill. I was in Washington for 8 years. This should not be the usual sausage making of pork barrel, right? When you do a piece of legislation in Washington, most legislatures, it becomes the expression sausage making. It becomes pork barrel. It goes through the political process. And the political process says everybody should get some money, which dilutes the funding, gives it to communities and governments that don't really need the funding, and doesn't even address the need. It's one of the reasons why people are so suspect of government spending, right? Because it winds up pork barrel. Every senator is going to say, I want money for my state. Every congressperson says, I want money for my local district. I want to be able to go home with a little package that I can hand to my local government. That's not what this is about in this case. This is about addressing a need and getting funding, precious funding, to people in places that need it. And the rule here should be money follows the need. It's that simple. What places need it? Self-serving, but New York State has 15 times more cases than any other state right now. Fund the states, fund the places that need it, follow the number of cases, and use need as the basis for funding. It's common sense. It will be respected by the people of this nation. And the alternative to politicize this funding process is intolerable. To my congressional delegation, I say, look, New York received no funding from the first coronavirus bill, even though New York has the greatest need. And that was a technical mistake in the way they wrote the bill. Political custom is one politician or elected official should not pressure people of their own party. My congressional delegation is largely Democrat. So political custom would be, well, don't pressure another Democratic elected official. I say that is baloney. I represent all the citizens of the state of New York. That is my job. It's a very simple job I have. I fight for New Yorkers, period. Democrats, Republicans, period. And this is no time to play politics. And we need our congressional delegation to stand up and to fight for New York. Also on the federal role, I'm requesting today from the federal government that the Army Corps immediately proceed to erect temporary hospitals. I went out yesterday, I surveyed the sites. There are several good options that give us regional coverage. An Army Corps temporary hospital at Stony Brook, which is on Long Island, Westbury, which is on Long Island, Westchester, where we have that terrible cluster, which is, thank goodness, reducing, and the Javits Center, which is a very large convention center in Manhattan in New York, and New York City is obviously where we have the highest number of cases. I met with the Army Corps. They've reviewed these sites. I approve it. I approve it on behalf of the state of New York, and now we just have to get it done and get it done quickly. These temporary hospitals are helpful, but they don't bring supplies and they don't bring staff. And that compounds our problem of not having enough medical supplies, and frankly compounds our problem of not having enough medical staff because we are trying to increase the capacity in our existing hospitals. The sites that we picked allow for indoor assembly of these facilities, so they won't be out of doors. They'll be indoors. Some places we may need to do them outdoors, but these campuses also have dormitories where the healthcare staff can stay. They're very large, there's space, and again, I have made all necessary approvals, so from my point of view, construction can start tomorrow. These are pictures of the places where we would assemble them in Stony Brook, Old Westbury, Westchester County Center in Westchester, all indoor locations, all open, all ready, accessible. Jacobs Javits Center, we just expanded it. It's one of the largest convention centers in the country. It's open, it is ready to go. There is no red tape on the side of New York. We're also asking FEMA to come in, Federal Emergency Management Agency, to come in and erect 4 federal hospitals at the Javits Center. The federal hospital by FEMA is different than the Army Corps of Engineer temporary facility. The FEMA hospitals come with staff and with supplies. They're in 250 bed configurations. We're asking for 4 of those 250 bed configurations to be assembled in the Javits Center. The Javits Center can easily manage them. It's in the heart of Manhattan. They're fully equipped. They're fully staffed. Again, we are ready to go as soon as the federal government is ready to go. That will then give us regional coverage in downstate New York, which is our most heavily impacted area. The president signed a FEMA emergency declaration, which allows FEMA to go to work. By that emergency declaration, funding for these services is split, 75% by the federal government, 25% by the state government. The federal government can waive the state's share, as they call it, waive the 25% from the state. I'm also requesting that the president waive the 25%. I just cannot pay the 25%. We literally don't have the funding to do it. And by the way, I don't believe any state will be in a position to waive the 25%. So I don't just say that on my behalf, I say that on behalf of all the governors. I'm the vice chairman of the National Governors Association. I've been speaking with governors all across the nation. No state has the financial capacity to participate, in my opinion. But I know for sure New York doesn't, because we are the heaviest hit state right now. I'm asking the president to do what I did here in the state of New York, cut the red tape, cut the bureaucracy, just cut to the chase, get the Army Corps of Engineers moving, get FEMA moving. Let's get those buildings up. Let's have them in place before that trajectory hits its apex. Time matters, minutes count, and this is literally a matter of life and death. We get these facilities up, we get the supplies, we will save lives. If we don't, we will lose lives. I don't mean to be overly dramatic, but I want to be honest, and that is the simple fact of this matter. We're also implementing the trial drug. We have secured 70,000 hydrochloroquine, 10,000 Zithromax from the federal government. I want to thank the FDA for moving very expeditiously to get us this supply. The president ordered the FDA to move, and the FDA moved. We're going to get this supply, and the trial will start this Tuesday. The president is optimistic about this, about these drugs, and we are all optimistic that it could work. I've spoken with a number of health officials, and there is a good basis to believe that they could work. Some health officials point to Africa, which has a very low infection rate. And there's a theory that because they're taking this anti-malarial drug in Africa, it may actually be one of the reasons why the infection rate is low in Africa. We don't know, but let's find out, and let's find out quickly. And I agree with the president on that, and we're going to start Tuesday. I also think the FDA should start approving serological testing for coronavirus antibodies, and they should do it as soon as possible. What this does is it tests the blood to see if you have antibodies that were created to fight the coronavirus. Remember, all the health officials say the coronavirus was here before we started to test. Many more people have had the coronavirus than we think. Most people have resolved the coronavirus who have had it. How do you know that? You can test and find the antibody that the body created to fight the virus. If you have that antibody, it means you had the virus and you resolved it. Why do you want to know that? because I want to know who had it, who has the antibody, which means they most probably will not get it again, and that can help us get our medical staff back to work faster. So it's a different level of testing, but I think the FDA should move as expeditiously as they have before on this type of testing. Find out who had it, who has the antibodies, and that will help us, especially on medical staff shortages. Also, on the state role, what am I supposed to do? I'm not just looking to the federal government. I understand that we are responsible here in the state of New York, and we're doing everything we can on hyperspeed. We have to expand the existing hospital capacity. This gets back to the 53,000 current beds when we may need 110,000 beds. We have said to the hospital administrators, we have a goal of you increasing your capacity in each hospital by 100%. Yes, an ambitious goal. Yes, very difficult. Yes, it may be impossible in some places. But remember, a hospital is highly regulated. Space is regulated. The number of beds in a room is highly regulated. We're waiving all those regulations and saying, just from a physical capacity point of view, see if you can increase your capacity 100%. Where do we get 100%? We have 53,000 beds. We have to get to 110,000 beds. Everybody increases by 100%. We meet the goal. Simple. A little too simple, but we understand many hospitals won't be able to do it. However, at a minimum, hospitals must give us a plan to increase capacity by at least 50%. So we would be at about 75,000 minimum against the 110 need. We would still have to find additional beds. I understand that. And you see what we're doing with the federal government. There's an opportunity there. But every hospital, goal of 100% increase in capacity, mandate of 50% increase in capacity. We also have an intensive care unit bed issue where we have to increase the number of intensive care units. That is limited by the number of ventilators. What makes an ICU bed in this case? It's that the ICU bed has a ventilator. And that's where we get back to needing the ventilators desperately, so we have those ICU beds. We're putting out a Department of Health emergency order to hospitals that says we're not just asking you to do this. It wouldn't just be a nice thing. I'm not just asking you as governor as a civic obligation. This is a law that the hospitals must come up with a plan to increase capacity, a minimum of 50, goal of 100%. We're also canceling all elective, non-critical surgery for hospitals as of Wednesday. Elective, non-critical. If it's a critical surgery, fine. If it's not critical, then postpone it. That alone should get us 25 to 35% more beds. And again, that is a mandate that is going into effect for the hospitals. I understand the hospitals are not happy about it. I've heard that. The elective surgery is a big source of revenue for the hospitals. I understand that, but this is not about money. This is about public health. And we're putting that mandate in place starting today. We're also creating additional beds in places where we can. We're taking over existing residential facilities, hotels, nursing homes, and repurposing existing facilities. For example, this is the Brooklyn Center for Rehabilitation and Healthcare, 600 beds that we're going to take over, and it will serve as a temporary hospital. And we're doing this in facilities all across the state. Two different facts. I want to make sure we're clear just so there's no confusion. Fact one, young people can get the coronavirus. They are wrong when they say they can't get it. They can get it. 18 to 49-year-olds represent 53% of the total cases in New York. This is not China. This is not South Korea on the theory that, well, I'm an American youth and therefore I have a superior immune system than China or South Korea. No, that theory is not correct. In New York, 53% of the cases, 18 to 49 years old. Second fact, older people and those with compromised immune system, underlying illnesses, can die from the coronavirus. You're right, the 18 to 49-year-old is probably not lethal, but you can get it, and you can get sick. And it's a nasty illness, and then you can transfer to someone else. That's the case for young people. Older people, obviously, if you're a vulnerable person, it can be lethal. Both facts are true, and both facts have to be understood. Young people can get it, you will get sick, you probably won't die, but you can transfer it to someone who may very well die. And you can transfer it even inadvertently without knowing you're doing it. You can touch a surface, walk away. A day later, someone can sit at this table and put their hand in the same place and contract the virus. I was in New York City yesterday. It was a pretty day. There is a density level in New York City that is wholly inappropriate. You would think there was nothing going on in parts of New York City. You would think it was just a bright, sunny Saturday. I don't know what I'm saying that people don't get. I'm normally accused of being overly blunt and direct, and I take that. It's true. I don't know what they're not understanding. This is not life as usual. None of this is life as usual. And this kind of density, we talk about social distancing. I was in these parks, you would not know that anything was going on. This is just a mistake. It's a mistake. It's insensitive, it's arrogant, it's self-destructive, it's disrespectful to other people, and it has to stop, and it has to stop now. This is not a joke, and I am not kidding. We spoke with the mayor of the city of New York and the speaker of the city council, Corey Johnson. I told both of them that this is a problem in New York City. It's especially a problem in New York City parks. New York City must develop an immediate plan to correct this situation. I want a plan that we can review in 24 hours so that we can approve it. There are many options. You have much less traffic in New York City because non-essential workers aren't going to work. Get creative. Open streets to reduce the density. You want to go for a walk? God bless you. You want to go for a run? God bless you. But let's open streets. Let's open space. That's where people should be, in open space areas, not in dense locations. There is no group activity in parks. That is not the point. We spoke about it the other day. All sorts of kids playing basketball yesterday. I play basketball. There is no concept of social distancing while playing basketball. It doesn't exist. You can't stay 6 feet away from a person playing basketball. You can, but then you're a lousy basketball player and you're going to lose. You just cannot do that. We also have bigger parks in New York City. We opened Shirley Chisholm Park in Brooklyn, 400 acres. Van Cortlandt Park. There are big parks. There are big spaces. That's where you want to be. But we need a plan from New York City. I want it in 24 hours because this is a significant problem that has to be corrected. In terms of numbers, I said yesterday, New York is testing more people than any state in the country, and per capita more than any country on the globe. That is a positive accomplishment, pardon the pun, because we want testing, we want more testing. We ramped up very quickly. We're doing it better than anyone else. And that is a good thing, because when you identify a positive, then you can isolate that person. And that's exactly what we're trying to do. When you increase the number of tests, you're going to increase the number of people who test positive. And the numbers show exactly that. We have now tested 61,000 people. Newly tested 15,000 people. So these numbers just are exponential to what is being done anywhere else in the country. And that's why you're going to see much higher numbers than anywhere else. Total number of new cases, 15,000. I'm sorry, total number of cases, 15,000. Total number of new cases, 4,800 new cases. You see the state, more and more counties. We're just down to a handful of counties now where we don't have existing cases. As I said, that is going to be 100% covered. It's just a matter of time. On the hospitalization rate, which is a number that I watch very closely, it's 1,900 cases out of 15,000, 13%. 13% is actually lower than it has been. We've been running at 15%, 16%, as high as 20%. This is 13%. This is the key indicator, because this is saying how many people are going to come into your healthcare system as the number goes up. So this is not bad news. Across the country, you see New York now has 15,000 cases, Washington State 1,600, California 1,500. So we have roughly 15 times the number of cases. Now, do we really have 15 times the number of cases? You don't know. We're testing much more than anyone else. So that is a major factor in this. But I have no doubt that we have more cases. We have more density. We have more people from other countries who come to New York than many other states. So I have no reason to believe that we don't have more. I don't believe we have 15 times more. I believe that's also a factor that we test more than anyone else. 114 new deaths, total number of deaths, 374. And that is a sobering, sad, and really distressing fact that should give everyone pause, because that's what this is all about, is saving lives, and we've lost 374 New Yorkers. Keeping it all in perspective, Johns Hopkins has followed this from day one, 311,000 cases, 13,000 deaths. Statewide deaths. To the extent we can research the cause of death and the demographics of death, what we're seeing roughly, 70% of those who passed away were 70 years old or older, and the majority had underlying health conditions, okay? So it is what we said it was. Approximately 80% of the deaths of those under 70 years old had an underlying health condition. So, young people can get it, young people will get sick, young people can transfer it. Mortality, lethality, older, compromised immune system, underlying illness. That's what we're seeing. But even within that population, the capacity of our health care system can save those lives. It doesn't mean just because you're 80 and you have a compromised immune system or you have an underlying health condition and you get coronavirus, you must pass away. That's going to depend on how good our healthcare system is. But in terms of overall perspective, I'm afraid for myself, I'm afraid for my sister, I'm afraid for my child. Older, underlying illness, be very, very, very careful. This gets back to Matilda's law. This gets back to my mother. That's my fear. This gets back to nursing homes, senior care facilities, et cetera. Personal advice, this is not factual. I try to present facts. I try to present everything I know. I try to present unbiased facts. I try to present numbers, because people need information. When do you get anxious? When do you get fearful? When you don't get the information, or you doubt the information, or you think people don't know what they're talking about, or you think you're getting lied to. So I present facts. This is personal advice. This is non-factual. So it's all gratuitous. You can take it, and you can throw it in the pail. But we have to think this situation through. Don't be reactive at this point to this situation. Yes, you are out of control in many ways. You're out of control to this virus. You're out of work. Situations are changing. They're not in your control. You don't even know how long this is going to go on. It's a very frightening feeling. That is true. But you can also take back some control. Start to anticipate and plan what's going to go on. Plan for the negatives and plan for the positives. There are going to be negatives and there are going to be positives. There are real economic consequences. How do you handle the economic consequences? You're not alone. It's everyone in the United States. That's why you see this federal government acting quickly to get funding into the pockets of families who need it. But think through what the economics mean. Think through the social issues and the social impact of this. Think through the emotional issues of this. You know, it would be unnatural if you didn't have a flood of emotions going on. It would be unnatural. Either you wouldn't understand what was happening or you wouldn't appreciate it. But if you know the facts and you understand what's going on, you have to have a flood of individual emotions, positive and negative, and anticipate it. You know, stay home, stay home, stay home. Whether you stay home, remember the old expression, cabin fever, right? You stay home alone, you don't want to be isolated emotionally. You can be isolated physically. You don't want to be isolated emotionally. You want to keep those emotional connections. You want to talk to people. You want to write letters. You want to have emotional connectivity. That is very important. If you're not alone and you're in the house with the family and the kids and everybody's together, that's a different set of emotional complexities. You know, being in that enclosed environment, normally the kids are out, everybody's going to work, and you're only together a short period of time a day. Now you're all in the same place for 24 hours. You know, I remember when the kids were young, what it was like. It was pure joy. But I remember what it was like to be with them for multiple hours. You know, it's complicated. I live alone. I'm even getting annoyed with the dog, you know, being in one place. So think that through, because that is real, and it's going to go on for a period of time. This is not a short-term situation. This is not a long weekend. This is not a week. The timeline, nobody can tell you. It depends on how we handle it. But 40%, up to 80% of the population will wind up getting this virus. All we're trying to do is slow the spread. but it will spread. It is that contagious. Again, that's nothing to panic over. You saw the numbers. Unless you're older with an underlying illness, et cetera, it's something that you're going to resolve, but it's going to work its way through society. We'll manage that capacity rate, but it is going to be 4 months, 6 months, 9 months. You look at China, once they really change the trajectory, which we have not done yet, 8 months, we're in that range. Nobody has a crystal ball. Nobody can tell you, well, I want to know, I need to know. Nobody can tell you. I've spoken to more people on this issue than 99% of the people in this country. No one can tell you, not from the superb Dr. Fauci to the World Health Organization to the National Institute of Health, but it is in that range. So start to plan accordingly. It's going to be hard, there is no doubt. I'm not minimizing it, and I don't think you should either, but at the same time, it is going to be okay. We don't want to overreact either, right? The grocery stores are going to function, there's going to be food, the transportation systems are going to function, the pharmacies are going to be open, all essential services will be maintained. There's not going to be chaos, there's not going to be anarchy, order and function will be maintained. Life is going to go on. Different, but life is going to go on. So there is no reason to be going to grocery stores and hoarding food. You see all this overreaction on the TV every day, which then makes you think, well, maybe I'm missing it. Maybe I should run to the store and buy toilet paper. No. Life is going to go on. The toilet paper is going to be there tomorrow. So a deep breath on all of that. But I do believe that whatever this is, 4 months, 6 months, 9 months, we are going to be the better for it. You know, they talk about the greatest generation, the generation that survived World War II. Dealing with hardship actually makes you stronger. Life on the individual level, on the collective level, on the social level, life is not about avoiding challenges. Challenges are going to come your way. Life is going to knock you on your rear end at one point. Something will happen. And then life becomes about overcoming those challenges. That's what life is about. And that's what this country is about. America is America because we overcome adversity and challenges. That's how we were born. That's what we've done all our life. We overcome challenges. And this is a period of challenge for this generation. And that's what has always made America great. And that's what's going to make this generation great. I believe that to the bottom of my soul. We're going to overcome this, and America will be the greater for it. And my hope is that New York is going to lead the way forward. And together, we will. Questions?
Governor, on New York City reducing its density, is it within your powers to do those sorts of things? And you're talking about closing streets to traffic, to increase pedestrian traffic. Can you explain the logic of what exactly that would look like in New York City?
I could make those decisions in New York City. In truth, Jesse, look, first of all, I'm in New York City, born and bred, if you can't tell. So I know New York City from every kind of dimension. I don't know the situation with the parks well enough, and I don't know the situation on opening streets, closing streets well enough. And frankly, I think the local officials are in a better position to make those decisions. They see this issue also. It's not that they don't see the issue. They see the issue. They see the problem. I want them to come up with a plan. I think they're in a better position to do it. I want to know what it is, and I want to approve it, because this is a serious problem. That density has to be reduced, and it has to be reduced fast, and that's why I'm asking for a plan from them in 24 hours. But I think they're in a better position to do it.
Would you imagine closing parks and playgrounds and things like that?
I want to see what they say. They know the problem, they see it. I mean, it's all over the place. It's not that, you need a microscope to find this. It is all over the city. Now, maybe it was a nice day yesterday or whatever, but it was all over the place.
Governor, hospitals in New York City, all the way up to the Capital Region, are running low on tests and medical supplies. They've stopped doing public testing. Some have stopped the drive-through testing. Is that the right thing to do at this point? Are we running low on medical supplies?
Well, Josepha, the main problem is the equipment. It's the gowns, it's the masks, it's the PPE equipment, and we sent 1 million masks to New York City yesterday. We have 1 million masks here, so we can supply hospitals, but we're talking about a very short period of time. We're then scrambling to buy all these masks. I have companies that are manufacturing masks for us. We're buying sewing machines to make masks, but this is not the way it should be done. Let the federal government, they have a law called the Defense Production Act, which is precisely for this. I get the president saying he wanted to work voluntarily with private companies and ask them to help, and I get the president saying the private companies were great and they came forward and they said, we want to help. I get that. I say, forget the voluntary partnership, order the companies to produce it, let the federal government do it, so that the private company doesn't wind up marketing with all these states that are competing. Think about it. We paid 85 cents for a mask. We're now paying $7 for the same mask. Why? Because California will pay $6, and Illinois will pay $6.50, and Florida will pay $6.75. I'm just making up those numbers. But that's not the way it should be. Let the federal government take the function of medical supply production and distribution. Just take it, right? When it came to testing, I said the exact opposite. I said to the president on testing, when everything was going through the FDA and everything was going through the CDC and it was slow, I said to the vice president, decentralize it. Give that function to me, the state. Why? I have 200 laboratories that I regulate. Give it to me, I'll turn on 200 laboratories. Rather than going through a bottleneck in the federal government, everything has to go through the FDA and CDC. So I said in that situation, give me the task. I'll get it done faster. So it's not like I'm trying to say the federal government should do something to take a burden off me. I've accepted the burden of testing from the federal government. And by the way, our numbers went through the roof. This task, they are in a better position to do than I am. Order the production of masks and gowns and ventilators. Give them a deadline. Don't get into this mad bidding war. They know how to distribute it because you look at where the cases are. And distribute it by the need of the cases from Washington. Let them take that. This is the president can do this. Frankly, it's the president's style to say, cut to the chase, this has to be done, and I'm mandating it, and he should do that here.
But to that point, should we now stop publicly testing and only test people who are either in the hospital or in serious condition at this point?
No, I'm not willing to give up the testing because the testing is one of the ways we slow the spread. There's only 2 ways to slow the spread. Density reduction, which we're all over, and we can't do anything more than that. We're already at 0 on non-essential workers. The second way is testing, find the positive, isolate the positive. So I'm not willing to stop testing because our number one job is slow the trajectory of the increase because I can't handle it in the hospital system.
But if the disease is becoming endemic, what's the point of testing, I guess? You know, if you yourself have said 80% of the population could become infected, at what point, is it a diagnostic test? What is the point of testing?
There is a point of inflection, you're right, where you could hit a point where the disease is so widespread, it's not worth the testing. We're not there yet, Jesse, because we're still trying to stop the apex, right? We have to bring down that curve. Even if we're successful on this health order, where we get the hospitals to go to 50% additional capacity, I'm still at only 75,000 beds when we need 110. I'm still only at 13,000 ICU beds when I need 37,000 ICU beds. I'm still at only 6,000 ventilators when I need 30,000 ventilators. So we have to do everything we can to keep that curve down, and testing is essential to that.
What should police departments be doing to enforce the rules once they go into effect at 8 p.m.? Should police be breaking up groups of people hanging out on the sidewalks or the streets or the parks?
That's what I want to see from New York City. I want New York City, I want the mayor, the city council, Speaker Corey Johnson, let them come up with a plan. Get it to me within 24 hours. I want to approve it, but I'm open to anything. But it has to be done quickly, and it's going to have to be dramatic action. Excuse me one second, because it's not, I can't say anything more than I've said, right? How many times can you say you're being reckless and selfish, and you know, it brings out the best, it brings out the worst. We all talk about being a community. We're a community. What does a community mean? We're interconnected. We're interdependent. I rely on you. You rely on me. That's community. That's us at our best, the community of New York. I need to be able to rely on you. And that means you have to be smart and responsible in your actions. And you have to be able to rely on me. And that means I have to be smart and responsible in my actions. And that's the social contract between us. I have a right to expect that from you, especially in dire circumstances. And we're not there, and we should be there. And I'm going to keep saying it, but we're also going to be doing it. And I want the plan from New York City to make that a reality. Sorry, I'm sorry.
The Attorney General today saying that she wants next month's elections to be absentee only statewide to like avoid people living in places. What do you think about that? Is that something you're discussing?
We are discussing, we have done increased absentee ballots for elections. I think it's a good idea anyway. We should have done it a long time ago. It's especially a good idea when you don't want a lot of people going to a polling place. Melissa was handling that issue.
Sure. Article 2, Section 2 of the Constitution says that there are only two ways that you can vote absentee. One is if you're sick, and the other is if you're unable to go to the poll. Over time, the legislature has legislated what it means unable to go to the poll as being out of county. And so what we're looking at is if our executive authority will allow us to overcome that, or if we have to talk to the legislature about changing the law to allow for it.
Okay, so you don't know whether yet you have the power to actually say suspend all voting in person.
Exactly, that's what we're reviewing right now.
Are there any new steps for nursing homes that are going to, that the state's looking at? We're seeing, some deaths at a retirement community and.
No, we've done everything we can. They are the vulnerable area, right? Because they're a congregation of the vulnerable population. We said no visitors, which is really dramatic and sad action, right? You're in a nursing home, you're alone, you look forward to family visiting, and then we say no family visitors. We're encouraging and working with the nursing homes for telecommunications and Skype and FaceTime and all that, but nothing new.
No plans to test all the workers there, the residents?
Yes, we have those regulations that before the staff comes in, they have to be tested.
Governor, I need to circle back on your comments regarding time matters, minutes count, this is a matter of life or death. How are you telling hospital staffers and hospitals in general to prepare while we wait to see whether the federal government hears your call to action? How are you telling them to prepare right now based on what you've described to us?
You got two separate tracks. It's a good question. Two separate tracks. One, state action. Assume no one else does anything but you, right? And I operate on that track. Assume the federal government doesn't do anything, and it's just New York State and New York State alone. And we're going down that track, and I'm doing everything possible on every level to do just that. And that's increasing the hospital capacity, minimum 50%, goal of 100%. They have to come up with a staffing plan to do that. That's finding the medical supplies for them. I'm not stopping on the medical supplies. We're manufacturing masks. I'm talking to uniform manufacturers to get them sewing machines to convert. I have apparel companies that manufacture in China to stop making dresses, to start making gowns. I mean, we're doing every kind of thing we can do. Child care facilities for healthcare workers, special protections for healthcare workers. Assume the federal government does nothing. And we have that plan in place. At the same time, I am saying to the federal government, you need to do what you need to do. There is a federal role here. And this emergency management protocol, well, we support the states. Yeah, you support the states if the states can do it. That's what the emergency management protocol is. I do this as a governor. There's a flood in Erie County. Okay, Erie County, you're in charge. Call me if you need something. Yeah, I get that. But if I know the flood can't be handled by Erie County, then I come in, and I'm the governor. And I come in and I say to the county executive, we're here, I'm the governor, I'm going to bring state resources. I'm saying to the federal government, and I'm saying to the president, you should take over the medical supply function. Invoke fully the Federal Defense Production Act, order manufacturing companies to manufacture it. Every state is saying, every city is saying they're running out of medical supplies. Do that. B, get FEMA, get the Army Corps of Engineers. You have the sites, tell them to come up here tomorrow and start building those emergency hospitals. C, pass the funding. Don't let the Congress make it pork barrel. Don't let them make it political patronage where everybody brings home 50 cents, but you actually don't fund the places that need it and the people that need it. Help the corporations, but don't help the corporations like we did in 2008, where the senior executives get tens of millions of dollars in bonuses, and now the taxpayers are supposed to fund that corporation to bail them out, and then the corporation 2 years from now is making record profits, and the normal economy hasn't rebounded, and the taxpayer who subsidized the corporation is still struggling to pay their mortgage. We did that in 2008. You want to give a corporation money? Say, okay, here are the rules. You can't buy back stock. I want the bonuses to CEOs back. I want an equity stake in the company. I want interest in the company, an interest rate on the loan, but something that gets the profit back to the citizen. You know, we're tired of making these big corporations rich at taxpayers' expense. Make sure the corporations live up to their civic responsibility, and you have total responsibility. If you're going to give them taxpayer money, then you get to write the rules. You know, from the president's point of view, this is back to his old job, right? Somebody walks in and says, I want an investment in my company. Okay, I'll give you an investment in your company, but here are the rules before I give you the investment in that company. I need the federal government to do that. The emergency supplies, the funding to the places that need it. I need my congressional delegation to actually represent the state of New York and deliver. We need FEMA here. We need Army Corps of Engineers here. We need those functions working as quickly as possible. And then we need federal assistance from the federal government. If none of that happens, then we're on our own. We're New Yorkers. We'll figure it out. Why don't you say? I'm sorry?
Does the eviction waiver mean no need for rent freeze? Or
Does
rent
the eviction waiver mean no need? You cannot be evicted for non-payment of rent. One other piece of good news. You know, we talk about all these increasing cases, and you get the virus. Most people, the virus resolves. Good friend of mine, great public official, Rick Cotton, head of the Port Authority, he had the coronavirus, never hospitalized. He was home for 2 weeks. He is now tested negative for the coronavirus. So he self-resolved. It was about 2 weeks. I don't even know that he needed all 2 weeks. I'm a little suspicious that maybe he resolved in 1 week and then he just took another week vacation, but I don't want to push the point. I'm going to go to work. Thank you guys very much. The state what? Oh, we are overwhelmed in the website. We have 700 people working on the website and telephones to handle the inflow of insurance claims.
The people out of jobs are telling us that the website is crashing. They don't know what to do.
It is crashing because we've never seen this volume. The IT consultants can't even figure out how to handle the volume. The volume is that high. But we have 700 people working on the website and phones, et cetera, to process those claims. I know people are frustrated. I get it. But we have never seen a volume like this in any state agency ever.
Room. Is that something that you would recommend at other hospitals?
That is not my area of expertise, so I'll leave it to them. Thank you.
I don't feel that there's been anywhere near the response that any place in this nation deserves, especially our nation's largest city with 8.6 million people on the front line. But I, at the same time as I'm deeply concerned and troubled and angry and frustrated at the lack of federal response, I am inspired by the response right here in New York City from everyday New Yorkers, from our public servants, from all the people who protect us and keep us healthy. So many good people who are stepping up. And I'm inspired because I believe if there's one place on earth that has the ingenuity and the creativity and the sense of entrepreneurship to find a way to overcome this crisis with our own resources, that's right here. Now, I want to be 100% clear. That doesn't let the federal government off the hook in the least. I couldn't be angrier at the lack of response. I've been very plain about that. But you know what? If we're going to be left to fend for ourselves in New York City and New York State, well, I can at least say there are no people on earth who are more creative and more able to create something out of even the most tough circumstances. No one's better than New Yorkers. We're going to find a way to do things we've never done before. And I've likened this situation to war many times because it is. That's just the reality, and we've only begun down this very difficult path. But I already see New Yorkers doing extraordinary things. I already see people volunteering to find the supplies we need, to build the equipment we need, to make things happen, even when previously we would have thought it impossible. Isn't that the history of New York City in a nutshell? People making things happen even though they were told it was impossible. That is the story of New York and New Yorkers. So we will do it again in our time, right here, right now. Let me turn to some specific updates and information I want to share with everyone. And I want to take a moment to really commend the people who are doing exceptional work right now, helping us all. Of course, our healthcare workers, God bless them. They have such a tough job at this moment, but they are showing up with energy and passion, protecting the lives of so many people. Our first responders, who we need them every day, every year, and we need them even more now, and they are at their posts doing their job brilliantly. Our transit workers, we're depending on them to make sure that everyone else we need gets where they need to go. And thank you to all the transit workers for what you're doing. And then there's a lot of even more unsung heroes who really deserve notice at this moment. You know what? Maybe in the normal course of life, you don't stop to think about the man or woman who works in the grocery store or the pharmacy, the postal worker who brings you every day things you depend on, and you're going to depend on even more now. All the delivery workers, whether they're in the public sector or the private sector, the men and women who deliver food and are now working at so many food establishments that are going through a tough time, but a lot of them are continuing to operate so they can help all of us. All those folks are answering the call in their own way. I want to thank all of you. We need all of you. And you don't get the praise you deserve normally, and you should get a whole lot of praise now, because all of you are helping to keep this city running, keep it together, and ensuring the people who need help the most are getting it. So thank you from the bottom of my heart. I want to note, and I want to ask everyone, if you see, this is a time, I say it a lot, that, remember to thank people who do so much for us. This coming week, we're going to be dealing with a whole different reality. We've never been under this kind of order to pause our lives, change our ways. It's going to take getting used to it. It's going to take adjustments. There'll be some trial and error for sure, but let's thank the people who are helping to make it work. If you see a first responder, a police officer, a firefighter, a EMT, thank them. Thank the transit workers, thank the healthcare workers, thank those educators who are going to be at those enrichment centers, taking care of the children of those essential workers. And like I said, the postal worker on your block, the person who delivers a pizza to you, anybody you come across who's out there making it happen, please give them some extra gratitude, because they deserve it. Each day, I have a very unfortunate obligation to tell you the overall situation in terms of the number of cases. I remind you, every case is a human being and a family, and the numbers, again, continue to be staggering. Confirmed New York City cases at this moment, this is based on information from 10 a.m. today, 9,654 cases, an unbelievable number. We couldn't even imagine such a number just a week ago. We are on the verge right now of 10,000 cases in this city. We essentially at this point, and this has been a trend over recent days, we represent shockingly about a third of the cases in the entire United States of America, and about 2/3 of the cases in the state of New York, or even more. We'll constantly keep you updated, but I want people to just for a moment reflect on that fact. This is a crisis affecting our whole state, our whole nation, but it's a crisis affecting New York City far more than any place else, just by the numbers. 1/3 of the cases in the entire nation right here. We have lost 63 people to coronavirus in just a matter of weeks. We're going to constantly update you what we see within these facts to help people understand this disease better. And I remind you, it's a disease that literally no expert on earth fully understands, but we're trying to constantly confirm our understanding and update people. But here is a fact that's important. As of this moment in New York City, and this information will be published in more detail shortly, there have been, in the age group from birth to 44 years old, so New Yorkers from the first moments of life up to 44 years old, within that group, there have been no deaths. And that is a very important fact, confirming a lot of what we understood previously about this virus. The breakdown by borough. Brooklyn is 2,857 cases. Queens, 2,715. Manhattan, 2,072. The Bronx, 1,411. And Staten Island, 593. Another very important point, and again, information will be updated constantly and made public when we can. But we've talked a lot, and I reflected a few days ago about a conversation I had with Dr. Anthony Fauci, who is the leading national expert in this crisis and who we all are turning to for important information. He's also a proud son of Brooklyn, proud son of New York City. He, days ago, said to me, we really need to educate people to the particular danger to those over 70 years old. Well, here's what we know in New York City so far. 35% of our hospitalizations related to coronavirus have been for New Yorkers who are over 70. 35%, over a third. But you should also know that people over 70 constitute only about 10% of the population of New York City. So what we're seeing is the over 70-year-olds represented among those hospitalized over 3 times more than their proportion of the population. That really reminds us that that's the particular thing we need to focus on. Folks who are much older, and particularly if they have those pre-existing conditions we've talked about so much. These are the folks in the greatest danger who we have to really move heaven and earth to protect, keeping them isolated and out of contact with other people to the maximum amount possible, supporting them, still giving them a lot of love and support, phone calls, FaceTime, everything you can do to support your older loved ones, getting them the things they need, but keeping them out of contact with others to the maximum extent possible to protect them. That's crucial. I'm going to talk for a moment about the situation with other levels of government, and it is ever there was a tale of two cities. This is it. The state of New York is doing so many wonderful things, so many of the right things to help people all over the state and certainly to help New York City. I commend Governor Cuomo and our legislative leaders in Albany, Speaker Hasty and Majority Leader Stuart Cousins, and so many people across the state government who are doing so much to help New York City right now. And on the federal side, it's almost exactly the opposite, where we're seeing so little. That is not to say there are not good people in the federal government trying to help us. And Dr. Fauci is a great example, and so many of the good men and women at FEMA are a great example. It's not one way or another, but when it comes to the decisions of government and the actions of government, really doing something tangible, we're seeing a lot of help from the state of New York and very little in the way of evidence that the federal government understands that our nation's largest city is in the crosshairs and that the federal government is going to actually do something about it. I won't dwell. I've been perfectly clear. We need our armed forces, and we need them now. And I'm very happy that we're getting the ship, the Comfort, coming to New York soon. That's very, very helpful. That's a great example of what our armed forces could do, but they could do so much more if they were fully mobilized, and we need them. We need supplies on a vast scale for this city. We are very happy that FEMA is here. That could make a difference, but so far we have no specifics on what supplies we will get when, and we need them now. I have, again, to compare, great appreciation for the announcement that Governor Cuomo made yesterday. 1 million more N95 masks coming to New York City soon. That's crucial. That's wonderful. But I have no such announcement from the President of the United States. In fact, he still has not fully utilized the Defense Production Act. He has not given orders to specific companies to not only produce those items that are needed most, starting with ventilators, but to ensure that they will be distributed to where the need is greatest here in New York and other key parts of the country. I believe that can't be done and won't be done unless and until our military is mobilized. And I don't know why on earth the president hesitates at this point. I think you're seeing a hue and cry all over the country for our armed forces to be activated. The time is now. Very quickly, and this has been put out publicly yesterday, I'll just give a brief overview. Number of personnel announcements. We are continuing to build out our team to deal with what is a wartime type of crisis. I want to thank for her extraordinary leadership my Chief of Staff, Emma Wolf. I announced yesterday that I will add to her title the designation of Deputy Mayor for Administration, and that will put her second in the line of succession after our first Deputy Mayor, Dean Fullahan. Both of them have been the paramount, outstanding leaders of the day-to-day operations that are being run out of our Office of Emergency Management and other locations, coordinating all the work of all city agencies. We, all of us, even though we're working remotely from each other in many cases, we are talking constantly throughout the day. I am being given every hour, literally, it seems, new decisions to make, and I'm determining the direction of the city's response. But I have extraordinary leaders to depend on to implement those decisions and to coordinate the work of all of our agencies. So a tremendous thank you to First Deputy Mayor Dean Fullahan and now a Deputy Mayor for Administration and Chief of Staff, Emma Wolf. I announced that we will have one of our most extraordinary public servants, our Sanitation Commissioner, Catherine Garcia, will take on an additional title as our COVID-19 Food Czar. This is a brand new concept, and it reflects the reality of what we're dealing with today. We hope to get good news from Washington of some kind of true stimulus package that will actually reach the people of this city and this country with substantial direct support, not token support, not one-time support, but deep ongoing support so folks can afford everything in their lives. We don't have that yet, however. I'm desperately concerned that a lot of New Yorkers are running out of money, and that's the money they use to buy food, among other crucial necessities. Commissioner Garcia, in her new role, will create a citywide network to ensure that food is available to those who cannot afford it. Food is available to seniors and vulnerable folks. Food is available to people who were working just a few weeks ago and no longer have any means of support. It's going to take a mobilization such as we've never seen before. She'll work with all of those agencies that currently do food relief, the Human Resources Administration, the Mayor's Office of Food Policy, obviously, state agencies, food banks, soup kitchens, so many amazing nonprofit organizations. She'll work with all of them, but she's going to build something bigger and more comprehensive than we've ever seen in New York City, on the assumption that food will become much more of an issue going forward and that many people will have a strain that they have not experienced previously because of huge disruptions in their own income. So I want to thank Commissioner Garcia for taking on that role. I've named Peter Hatch as our COVID-19 public-private partnership czar. He will work with private sector entities and philanthropic partners to create a brand new network of support. There are so many wonderful offers of help coming in. We have to build that into a truly organized, forceful effort to ensure that the maximum private and philanthropic help reaches those in greatest need and augments everything we're trying to do as a city. Peter Hatch served previously as as Chief of Staff to Deputy Mayor Raul Perea-Hense. He will take on this new role as the public-private partnership czar. Also coming back into city service, my senior advisor for years, Gabrielle Fialkoff, who played a crucial role activating many forms of support for the people of this city. She did an outstanding job over 5 years serving the people of the city. She's returning as a senior advisor. She will ensure that many of the organizations that previously she worked with to help in normal times will help even more now in these tough times. And replacing Peter Hatch in his role as Chief of Staff to the Deputy Mayor Raul Perea-Hense, Deputy Mayor for Health and Human Services, will be Julie Barrow, who has worked in our intergovernmental affairs operation, and thank her for taking on that new role. Lastly, we're going to be doing something, I'm announcing this now, something we have not had to do in our recent memory in this city, which is to organize production here in New York City for vitally needed supplies and equipment. The notion of this city being left in so many ways on its own to deal with this crisis is deeply painful, but we don't take it lying down. We're going to fight for all the resources and support we deserve and need. But in the meantime, I've named Carl Rodriguez, who is currently Chief of Staff, to Deputy Mayor Vicky Bean, Deputy Mayor for Housing and Economic Development. Carl will additionally take on a role running our production capacity group. This will be leaders from different city agencies working with the private sector to determine to the maximum extent possible, quickly, tangibly, how we will produce ventilators right here in New York City, surgical masks, hospital surgical gowns, anything and everything that we need. This is in no way letting the federal government off the hook. But it does say that if we can effectively produce something in New York City, even if it is not exactly the ideal we would want, but it's still usable, we will produce it here. I want to thank Carl for taking on this role and all those who will be working with him. Quickly, I'll talk about some other items and then turn to our police commissioner who will give you an update. On the question of parks, I spoke earlier with Governor Cuomo. We are fully aligned. We understand that we have a big and different and new challenge on our hands. Folks who are going to be home in a way that literally doesn't happen any time of the year, not even in summer, to have so many people home at once, so many families and so many children looking for some opportunity to get out of their homes, at least for a small portion of the day. Here's how we're going to do it, and I'm going to describe what we're going to do in the first week, starting Monday and throughout this coming week. And then we're going to judge the results accordingly, and we might then make some very different plans. And again, one of the things I want to emphasize, every single day, instructions can change based on new circumstances because we are dealing with something that we've never dealt with before. We're going to always try and give you clear and consistent information, but I'm also warning people it can change. If it changes for a reason, and we'll certainly explain why. So on the parks, we understand that under the governor's pause order, which I entirely agree with, we need to ensure that if people want a little exercise in their day, that they can do that the right way. It is absolutely normal and human to want to get outside, get a little bit of exercise. But I remind you, the pause is all about social distancing. It is all about protecting ourselves and our families and each other. When we say you can go out for some exercise, we're not saying you can linger. We're not saying you can make a day of it. We're saying go out, get a minimum amount of exercise, get what you need, and then get back indoors. Same with grocery shopping. Go get what you need, get back inside. Gotta go to the pharmacy, get what you need, get back inside. We will be enforcing this, but with understanding for the challenges that people are facing, for how new this is. And I'll talk about it, and then Commissioner Shea will talk about it. We'll enforce through education. We'll enforce through warnings. We'll enforce with having real conversations with people to help them understand what's going on. We're not going to be draconian. We're going to give people a chance to get used to this. But I guarantee you we will enforce this new reality. And I think the vast majority of New Yorkers will understand quickly and will act accordingly. So, folks will go to their parks. That's normal. You want to get outside for a little bit. You want to get some exercise. You want to go for a run. Whatever it is, that's normal. You got to socially distance. You can't do it the way you used to. You can't play team sports at this point. It's going to be, unfortunately, quite a while before that's possible again. There's no more gatherings. There's no more events. There's no more big barbecues. All that is gone for now. It's not gone forever. It's gone certainly for weeks, probably for months. At some point, we'll be able to resume a more normal life. But for now, when you go to the park, you're going for your own exercise. Now, you might say, well, wait a minute. What if it's a parent going with their child and they live under the same roof? Of course, if you're already living with someone under the same roof or a couple that lives together, let's be clear, that's a different reality. People who live under the same roof and are already exposed to each other all day long, and this is something the governor and I explicitly discussed, they already have a different reality, and they don't need to distance from each other because they're already in constant contact with each other. So if a mom goes to the playground with her child, obviously she's already in constant contact with that child. That's different than if that child came in contact with a child from another family, or that mom came in contact with a mom from a different family. That's the problem. Let's be clear. Within the family, under one roof, that's one thing. But families mixing, people connecting who are not under the same roof, that's where we're going to see a spread of this disease that we can't have. That's where the social distancing rules come into effect, 6 feet apart. And we all want to be social, but we just can't the way we were. So you can go to the park, but only for a limited period of time. Families can stay together, but don't mix with other families. If you're going on your own, stay on your own, keep 6 feet apart from everyone else. Go, get your exercise, get home. In terms of playgrounds, this is a thorny issue, and I'm saying this as a parent. I used to take my kids to playgrounds around Prospect Park in Brooklyn constantly. I understand a lot about the culture of our playgrounds and the challenges that we deal with in normal times with all the kids who want to be on the playground. Here's what we're going to do for this next week. And I'm only saying this for this next week because we want to try it out. We're going to say to parents, look, here's the reality. If you're going to go on a playground, you have to take full responsibility for the situation. Full personal responsibility. Here are some of the realities. We cannot have overcrowding on a playground. If there are some people already on the playground, it's starting to get so you can't keep 6 feet away from people who are not part of your family, don't go on the playground. If our police, our parks enforcement officers, or other enforcement agents see a playground that's starting to fill up, they're going to clear it out. If you go to the playground, you need to keep your children away from children who are not part of your family. That's your responsibility. We will always do our best with city enforcement, but we can't be everywhere, obviously. You have to take responsibility. If you don't feel you can do it, don't go to the playground. Some parents have said, will the playgrounds be cleaned and sanitized? The answer, just a real blunt New York City answer, is no. They never have been. They can't be in this situation. It would take a Herculean effort every 5 minutes, literally, that we simply can't do. If your kids go to the playground, you might want them to not be on certain types of equipment or any type of equipment. You might say, I don't want to go to the playground. I just want my kids to run around in an open area. You parents have to make that decision. Well, what we're going to do is have playgrounds open to the maximum extent possible, monitored and enforced, but parents have to make their own choices for this next week as to what they feel is appropriate. I'm trying to give you real, honest warnings. We'll put up signage. We'll constantly reiterate these rules, and we'll see how it goes for a week. If people are responsible about use of the playgrounds, and we believe it's a good outlet for kids who are only going to get a short period of exercise each day, we'll keep them open. If we feel that they're not being handled properly, if we feel that people are taking advantage in the wrong way of the situation or not paying attention to the rules, or it's creating something that's just not supportable, we'll have to, at that point, strongly consider shutting them down. It's not something I want to do. I really don't want to do that. I'm saying that as a parent. So we're going to see how this week goes. And we have agreement with the state of New York that that is the approach we'll take. Tomorrow, I'm going to provide the state with a written plan delineating what I've just told you in broad stroke, and we'll work with the state each step of the way going forward to determine how best to handle the real sense of reality of our parks and playgrounds. But again, NYPD is going to be out there. If they see anything that looks like even the beginning of a gathering, they're going to say, break it up. They're going to say, you got to get your quick exercise individually and get home. The message couldn't be clearer. And Commissioner Shea will give you a sense of what he's experienced in recent days. But I can summarize it. New Yorkers are listening. They are following the guidance they're getting. And when a police officer or other enforcement officer tells them to do something, overwhelmingly, they are doing it. They all understand what time it is. So I think we're going to see that we're going to find a way to make this work. Okay. Very quickly. Let me just note, hold on one second. Oh, this is consistent with this point. to confirm just how much New Yorkers are adhering to rules, I want to give you an example. It's a very striking example for anyone who knows this town and has been here for any amount of your life, especially if you've been here a long time. I think you might find this striking. Yesterday in New York City, we sent out 4 agencies, NYPD, FDNY, Department of Buildings and Sheriff's Office, to continue doing enforcement at bars, restaurants, movie theaters, gyms, any place that we needed to ensure people were not congregating. There were 13,000 inspections yesterday by those agencies, 13,000 inspections, of which in only 11 instances was a violation given. 1 in 1,000, less than 1 in 1,000 cases was it even necessary to give a violation. I think that speaks volumes about what we are dealing with now. A very important topic. There's been a lot of concern about our jail system. I'm going to be giving you constant updates. This is an area of tremendous concern, obviously. Talked about an initial group of inmates who were being reviewed for release. This will be an ongoing situation and a rapid one. I have been working closely with the police commissioner and other officials, and obviously our correction leadership, to determine the proper approach that is humane and responsive to this crisis, but also constantly takes into account, public safety and obviously legal requirements. 23 inmates are being released today from our jail system. Those individuals are over 50 years old and low risk to reoffend. Some others, we're awaiting a response from the state before they can be released. We are now starting immediate work on a group of 200 additional inmates who are being reviewed for release. We will have the update on what number within those 200 will be released. That update will be tomorrow. These are primarily individuals who have limited time remaining on their sentences on Rikers Island. For all those who are concerned about this issue, I'm concerned, the police commissioner is concerned, the health commissioner is concerned, the correction commissioner is concerned. We're all trying to make sense of a very challenging situation in an appropriate way. We are looking at each individual case. And some of the portrayal of the situation, I think, has left out some of the complexity. There are individuals who I think are obvious candidates for appropriate release. There are some other individuals with complex histories that raise other questions. We're going to strike that balance, but we will continually update, continually look at tranche after tranche of inmates for potential release in this crisis. This next group of 200 we will have an answer on by tomorrow. There's a very rigorous effort being made right now in our jail system to keep everyone healthy and safe. There's a lot of resources being applied for the safety of our officers and inmates alike. That effort will continue to intensify. We have updates. I know some of them, I believe, have been announced about changes in testing locations. You can hear later on details from the health commissioner and from our health and hospitals CEO. There's been a closure of the site at Jacoby. We'll explain that when we get to Q&A. Everything is being done specifically related to prioritization. That means ensuring that we get to those individual patients in greatest need, and we do everything we can to use our testing capacity, ease the burden on emergency rooms. Testing has been fully focused on priority needs, structural needs to keep our health system going, to reach those in greatest danger. It will be tightly organized according to that principle, and we can get into detail in the Q&A. Few other points quickly. For our healthcare workers, these are the people, there's so many heroes in this city, and there's so many people we're depending on. I think we can all agree there is no group of New Yorkers we are depending on more right now than our doctors, our nurses, our lab techs. Every human being who works in our healthcare system is precious right now. These folks are doing heroic work. They're working exceedingly long hours. They are putting themselves at risk. We must support them in every way we can. A small but helpful thing we can do right now, in light of the profound changes in this city, the fact that so much of this city is not operating the way it normally does, and the idea of commuting has been fundamentally changed, and so many parts of our city are not seeing the kind of traffic, et cetera, that we're used to. We're going to do something temporarily in this crisis and grant parking permits to healthcare workers who we need to serve this city in this crisis. So there'll be a process to determine who qualifies, and we will begin with 10,000 permits for these heroic workers that we will start to distribute as early as tomorrow. Related to how people get around, there's an excellent question in the last day or two on what is essential in terms of how people deal with this crisis. And the question that was asked of me is if car repair, mechanic shops, automotive shops are being kept open, shouldn't bike repair shops be kept open? I thought it was a very good question. We in the city have compared notes with the state, and we have agreement that yes, bike repair shops are essential at this time of crisis because more and more people depend on their bicycles. So yes, we will instruct that bike repair shops will be treated as essential. And if they are open, all of our enforcement agents will know to respect that and allow them to keep doing their work that we all need. Finally, before I give you a few words in Spanish, just to say, I don't think anyone will be surprised to know that since we're in a crisis, we really have to be careful for everything we need, everything that's a basic need, and nothing is more basic when it comes to protecting people's health care than ensuring that there is a blood supply to serve all New Yorkers. Right now, our blood supply is sufficient, but a lot of the blood drives that happen throughout the year, particularly based in companies that we appreciate deeply, a lot of those have been canceled because the companies have had to shut down. Giving blood is essential, so we need New Yorkers to step forward. Go to any New York Blood Center site in the city. If you are going to give blood, everyone will know that that is an essential activity. Again, you go, you participate, every one of us says thank you, and then get back home as with everything else. If you are ready and willing and able to give blood, please call 800-933-2566. Again, 800-933-2566, or go to www.nybc.org, nybc.org. Everyone, I've heard from so many New Yorkers who want to do something, who are looking to be helpful and are frustrated by this crisis and want to help. Here is a way that anyone who qualifies can help. So we really, really appreciate that. In Spanish, comenzando esta noche, solo los negocios esenciales estarán abiertos en la ciudad de Nueva York. Les insistimos a todos, quédense en casa, a menos que tenga que salir por razón esencial, y protejan a los más vulnerables. Los meses que vienen van a ser difíciles, pero vamos a superar esta crisis, como siempre lo hacen los neoyorquinos. With that, I want to turn to our police commissioner. I want to thank you, Commissioner, and all the men and women of the NYPD for absolutely outstanding work in this crisis. And I know together we're going to be figuring out how to do some new things. But I know you are up to the task, as are the men and women who serve under your command. Commissioner Dermot Shea.
Thank you, Mr. Mayor. As the mayor said, it's been an interesting couple weeks here, but I can tell you definitively that the men and women of the New York City Police Department, as well as all the other city agencies, certainly the healthcare workers across the board, are rising to the challenge. And it's at a time like this when, quite frankly, you see the best in people come out. And we're seeing it day in and day out. The traditional crime that we put on the shoulders of the men and women of the New York City Police Department has not been forgotten, but there is so much more that they've picked up in the last couple of weeks. Just most recently, in the last couple of days, we've begun surveying over 500 large supermarkets in New York City. Just yesterday, in the last 24 hours,
Between pharmacies and supermarkets, over 1,600 visits by the men and women of the New York City Police Department, and literally no issues. A couple discussions about overcrowding, but overall very well. In the last 24 hours, over 5,500 bars and restaurants, and that's the story that you're continuing to see, cooperation by New Yorkers. 2 arrests out of 5,500, and that, I believe, is 1 incident in Queens. So by and large, we are seeing cooperation. We're seeing New Yorkers rise to the challenge throughout the city in all 5 boroughs. You're seeing tasks picked up by the men and women of the police department in reaching out to elderly people that may not be serviced by traditional means, and working with elected officials, working with community partners, getting them food. So I can tell you that I couldn't be more proud of what I've seen. To the parks, the mayor mentioned the parks, and in the last couple days, it's an interesting dynamic now as we get through this time where we've been all stressed, I think, and all pent up inside, and we are like no other city in the world. In a city of over 8 million people, a vertical city. And you saw yesterday people getting out, exercising, which is a good thing. I can tell you that I hit in the last 48 hours, the East River Park, the West Side Highway. I personally saw Riverside Park, Central Park. Over 99% of what I saw is what you hope to see. New Yorkers coming out, parents with kids, responsibly, getting the exercise that the mayor talked about. No, I did not see organized sports. The biggest thing I saw was a 2-on-2 pickup game. And I can tell you that the men and women now of the New York City Police Department are getting more and more involved in this, as the mayor said. I made calls yesterday with some of the borough and bureau commanders of the NYPD to just reinforce that messaging piece of this. We're all in this together, reinforce that positive message. As much as you want to get out, there's a responsible way to do it. And that's what we all need to hear and take part in. So you'll expect to see police officers throughout the 5 boroughs, whether it's on a bicycle, probably on some scooters and some marked police cars, driving slowly through the parks and just broadcasting and speaking to people about that message. Enjoy, how you doing? Get your exercise, and then politely get out of here. And I say that tongue in cheek. We are all in this together, and it was heartwarming, I'm sure, to see. Mr. Mayor, you touched on it. People that are behind closed doors all day, every day. That's not really what we're worried about when they're walking. A husband and wife holding hands in the park, taking a walk with their dog. That's not really what we're worried about. They're together in the apartment anyway, but it's the large groups. I heard from some elected officials yesterday and throughout the city working on this. We gotta think long distance here. This is a long game. So those backyard parties, those DJs, I'm sorry, DJs, I know how everyone is hurting here, but we can't be having parties with large gatherings, whether it's in backyards or anywhere else in New York City at this time right now. It's just too dangerous. So thank you. I'm sure we'll have some questions, but again, on behalf of all the men and women of the police department, thank you for all the kind words. We are there for you, and we're going to continue to be there for you.
Thank you very, very much, Commissioner. I think you laid it out very, very clearly. I think you said a very nice version of "get out of here." I like that, and we'll make sure the message spreads in a very smart, fair, decent way. With that, want to make sure that we now have an opportunity to take questions from the media on all the things we talk about here and any other topics they would like to bring up. And let's turn to the media questions. Who's first?
Hi, all. Just a quick note at the top. We ask that everyone limit their questions to no more than 2, including follow-ups. This allows us to be fair and try to get to as many people as possible. We will start off today with Aaron from the Post.
Hi, good afternoon, Mr. Mayor. Can you hear me?
Yes, indeed.
So just wanted to circle back on the issue of parks and people going outdoors to get their exercise. And just wanted to see if there's any sort of understanding as far as what the cutoff would be, how much time is enough time, and also understanding that people have been pretty good about abiding by these rules as far as businesses goes, what the sort of potential enforcement or penalties might look like if you encountered anyone particularly obstinate.
I'll start, and I'm sure the commissioner has a view too. first thing I want to say is the NYPD, every single day, and I would say this about parks enforcement, and, you know, depending on how this plays out, we could easily get other agencies involved as well. But the story that I think is missed, and I don't ever blame the media for telling the exceptional story or the dramatic story, but I would like us all to do a little bit more, particularly in a time of crisis, to acknowledge what is exceptional and dramatic and unusual versus what is typical. When you hear the number of inspections were made and you only had 11 violations, as I mentioned earlier, out of 13,000 inspections, that really says something not just about store owners, but about what people in general are understanding about this crisis. And I have seen it in many places I've been in recent days. I really think there's a deep understanding that something profound has changed and it has to be handled differently. And I have a lot of faith in New Yorkers. I have a lot of faith in everyday people. Will there be some individuals out of 8.6 million people who don't get it? Of course. And our officers, for time immemorial, have had to deal with people who don't get it, people who try and make their own rules, people who think they're smarter than anyone else. I assure you, there's no one more worldly wise than a New York City police officer. There's no one who understands the human condition better than a New York City police officer. And they are extraordinarily resourceful, our officers. So sometimes they use humor, sometimes they use firmness, sometimes they illustrate their point. Whatever it is, I've seen it throughout my life. They know how to talk to people. They know how to talk to young people and old people. They know how to talk to every kind of person. They'll make clear what you got to do, and I believe the vast, vast majority of New Yorkers will listen. We're not to the point yet of specific sanctions because we're starting down a road, and we'll decide with the state if we need to get into sanctions more deeply, but I don't think that's going to be the case. I think the number of people who truly don't get it and try and stand apart is going to be limited. And I affirm, if someone really wants to disagree with a police officer and acts in a manner that's inappropriate and illegal, well, then they will be handled the same way as anyone else who obstructs the work of a police officer. But I don't think we're even talking about the level we might see of that in normal times, because we're dealing with a crisis that's being felt in every inch of our city. I predict you're going to see a different reality and the word will spread. And I'll turn to the commissioner one more point. How much time? Well, you know, we're going to work on this, and I think it would be helpful to give people some guidance. But I just want to start with common sense. How much time does it take to exercise? Folks who go for a jog in the morning know how long they go for a jog. People go for a bike ride know how long their bike ride is. People go for a walk know how long their walk is. You know what? If you're exercising now and you have a basic thing you do, for a lot of people I'd say it's a half hour, 45 minutes, something like that. Go get in your exercise and get home. Or go do your exercise, go to the store, get home. The point is maximize the get home part. Get only the most basic exercise. Understand you need to walk your dog, and then get home. Your kids, understand you have young kids that are going crazy inside. You need to get them outside for a while. Get them outside for a while. As soon as you get them through a little bit of, working off their steam, get them back home. So we'll give some guidelines, but this is also about personal responsibility. This is about common sense, which is what the vast majority of New Yorkers have. We're not going to allow gatherings. We're not going to allow loitering. We're not going to allow someone just to hang out and, for a long period of time. If an officer sees you and you're sitting on a park bench, they're going to say, hey, you need to get home. The person says, I'm only going to be here for a few minutes and I'm going home. Fine. If someone thinks they can hang around for a long period of time, I assure you that officer will remind them again energetically. But people just have to get it. We have to help ourselves and each other by taking seriously, just what you need, nothing more, and get home. Commissioner.
As I hear this discussion, I'm thinking, and I laugh at the reputation that we have as New Yorkers of running around, running from one location to the other, bumping past each other, probably like no other city. I've seen the opposite in the last 2 weeks, and I'm sure you have too, whether it's in parks or walking around. There's a forced politeness these days of allowing one to pass before you proceed down a path. That's what I saw in the parks yesterday, and not universally, but you saw people giving each other that wide berth. In 2 weeks, we've learned to distance, whether it may not always be 6 feet, it may be 3 to 4 feet, but you're seeing this all over. and I saw it yesterday in every park that I visited. Not universally, some issues. We will double down on the education piece. And this, I'll tell you, on a personal level, this hurts. The last thing you want to do is tell kids that are doing everything we want them to ordinarily, but not under these extreme circumstances, get out of a park. But we have to, we'll continue to educate. And again, I think the message here is you can find 3 or 10 or whatever it is messages on Twitter. I was out there myself and saw it firsthand. By and large, there were no large organized sports. There was people getting out on a beautiful day in a really difficult situation. And we'll continue to monitor it. We'll step up the presence as well as the audio messages and the speaking. And again, this is probably the least of my concerns.
I want to just build
Please,
on
Commissioner.
that. I just want to build on that to say, as the mayor mentioned, we want New Yorkers to use good judgment in terms of time, but I want them to pay special attention to ensuring distance. This is about distance. This is not so much about time as it is about distance. And the longer, given the density of our city, the longer someone stays outside, the greater the risk of coming in contact with someone within that 6 feet perimeter. And so that's why focus on distance, not so much on time.
Right. That's great. And I want to just put a point on that, and then we'll keep going. I think Commissioner Barbeau said something that's really good common sense guidance. Yeah, if you stay out longer, your chances of bumping into someone, your chances of being put in a situation that's not the ideal, which is 6 feet apart, those chances increase. Where do you know you're not going to bump into someone or end up coming in contact with someone else who, God forbid, may have the disease? At home, right? It's when you're at home, you know what you're dealing with. So you get the exercise you need, keep it as tight as you can in terms of time. You go to the store. Even if you go to the store, keep your time as tight as possible. Observe that 6 foot distancing. Soon as you're done, get back home, because that's the safe thing to do. And it's not going to be fun. It's not going to be easy, but it's also not going to be forever. And we want to keep people safe. Go ahead.
If I could just, one more in that vein, Mr. Mayor. Governor Cuomo this morning floated the ideas of potentially opening up some streets, or I should say closing them to vehicular traffic and opening them up for people who want to get out, stretch their legs, get a little fresh air. Is that anything that's being considered? And thank you all for your time. I appreciate it.
Thank you, Aaron. I spoke to the governor about this, and we had a great conversation, and we're going to codify in the next 24 hours our approach here in New York City, share it with the state, with the governor's team, and we'll take it from there. But we had a high level of agreement in the conversation earlier today. We're certainly going to consider over time the possibility of opening up some streets for recreation, but I want to caution the first frame is the first frame here, which is we want people to get that exercise, get that time they need, but we also need to enforce it. And our ability to enforce directly correlates to knowing where we need to put our focus, our energy, and our officers. We know where that is right now in terms of our parks and playgrounds, because right now the NYPD patrols those areas, the parks enforcement patrols those areas. That is something that we can focus on, have a strategy for, and do the right way. If we're going to expand, we're going to expand very purposefully. If we're going to look to have a street that's opened up for recreation, we're going to do that very smartly and carefully, because we have to attach enforcement to it. It cannot be, oh, we're just going to close off some streets and leave it be. If we do that, I guarantee you what will happen is a whole lot of people start to congregate. And again, because we're humans, we're social, it's natural, and people won't remember, and they'll fall into. I see it all the time in the last few days. People start to reach out their hand to shake hands or start to want to hug someone they know, and they stop themselves almost without exception. I find that sort of sudden stop. It's going to take us a long time to get used to it. So if your block, if you put barriers at the end of your block, everyone's going to come out and hang out like it's normal. We can't have that. We got to do this in a systematic, careful fashion. So that's an idea that's on the table. What I would say is think of it this way. We're going to start with the parks and playgrounds we have that we know how to patrol, determine over the coming days if we need to expand that, and if so, how. But most importantly, how do we enforce it? How do we keep eyes on it? How do we make sure it works? So one stage at a time, and we will keep people updated as we do. Go ahead. Thank you.
Next, we have Alex from the Daily Beast.
Go ahead, Alex.
Hi. Hi, can you hear me?
Yep.
Okay, great. There's growing concern among a lot of gig economy workers, not delivery people, but freelancers in general. We've now passed a cycle of a single paycheck and some people are out of money. If someone is entirely out of money, let's say, and that goes everywhere from rent to food, what actions should they be taking?
It's a very painful situation. I'm glad you raised it, Alex, because this is, I think the gig workers are facing some of the toughest dynamics here. Obviously, it depends on each individual. Anyone who, again, everyone's different. Everyone's a different situation. Anyone who does have the opportunity to apply for unemployment insurance obviously should. But we also know that system's overloaded. I'm not belittling that fact. We are hoping and praying that the Congress acts very quickly on a stimulus that is direct money into the pockets of working people, including gig economy workers. Obviously, there have been some other actions taken, which I'm happy about, including by the federal government, like limiting student loan repayments and actions that have been taken by the city and state to ward off evictions. All of those things help. But we're going to have to do a lot more. And again, the place where we need help the most is the federal government, because the city is, really struggling right now to cover needs with what we have and with our own resources and our revenue that's clearly declining rapidly. So I think it is that stimulus bill. And then it's the things we're going to try and do. That God forbid there's a gig worker who, as you said, hasn't gotten that paycheck, is starting to struggle to find food. That's exactly why Catherine Garcia has been named to this new position, to create a food network, a food distribution network to help people who, honestly, maybe a few weeks ago, never in a million years would have thought of needing food and government support like that, but now they will. So at least with no evictions at this moment, hopefully people can pay the rent on time, but if they can't, they won't be evicted right now. And we're looking to find other ways to provide support and relief to ensure that people don't have money or not forced to pay rent that they just can't afford. Hopefully we can ensure there's a steady supply of food, and that will at least get us a fair amount along the way. And I remind people, in terms of health care, there's going to be people who won't be able to afford medicine. We're going to try and work on that issue too, but anyone who really is dealing with a serious health care issue, thank God for our public hospitals and clinics that will always back people up, regardless of ability to pay.
Thank you. And one more question. It's being reported right now that 2 dorms of 45 people incarcerated at Rikers are refusing to leave their dorms for work duties and meals in protest. And I'm just curious, is there a way that you guys could be possibly like speeding up the release and relief of certain prisoners in our jail system?
Yeah, we are absolutely going to move very fast now. We had to work through some legal issues that were complex issues, as I said, involving DAs and the state. We have a clearer template. We were working on this literally past midnight. I was here in City Hall after midnight, still on conference calls with people working this through, because this stuff is very complex. But I am confident now that we have the ability to figure out what that right number is. I don't know the number yet. I want to be real with you and honest with you. And there's some people who clearly we are not going to feel comfortable releasing. But we will steadily increase the number to the point that we believe is appropriate. I cannot confirm the report that you just gave. I've heard that, but I have not heard it in a confirmed manner. So we will get that information clarified. But suffice it to say, over the next few days, those who can be released to the maximum extent possible, we're going to try and do that over the next few days. Go ahead.
Next up, we've got Amanda from Politico.
Go ahead, Amanda. Amanda?
Can you hear me okay?
Yep.
Hi, how are you?
Good.
I have a question for you and Dr. Katz. I was hoping you could circle back to the Jacoby.
Yes,
testing issue.
Dr. Katz is not in the room, but through the miracle of technology, I think he can hear us. Dr. Katz, can you hear us? Dr. Katz. Paging Dr. Katz.
He's
Is
on.
there Dr. House? He's on? He can't respond to me, is that right? But he's talking on the line? Okay,
Amanda, we'll come back to you.
we'll be right back around.
Appreciate
Okay,
it. Thank you.
who's next?
We have Ashley from the New York Times.
Go ahead, Ashley. Ashley,
Good afternoon.
there you go.
Yeah, I'm here. The question I want to ask is for the police commissioner about exposure, since officers are basically intensifying their role in the corona, in kind of making sure that everybody adheres to the rules. I'm wondering if you can give us raw numbers on people who are infected and out sick due to coronavirus inside the department, and tell us how, if and how the NYPD tracks exposure.
So, yeah, Ashley, at the beginning, I had a little trouble hearing you, but I think I got the whole thing. The most current numbers that I have, and they are moving, is 98 members of the NYPD have tested positive for corona. Of the 98, 70 are on the uniform side, 28 are from the civilian side. It's important to know that in terms of how they contracted it, you know, the belief at this time, with very limited information, obviously, is that it's not necessarily contracted at work. There's some are contracted sick family members. We are New York. So as society contracts this disease, and, you know, so do we. In terms of the testing, the numbers are going up because the testing on the entire city is going up, so that's not unexpected. In terms of sick rate, I'll stay away from exact numbers, but I can tell you that our normal, if you have a normal sick rate, and we do, for the department, it's approaching about double that rate. And we saw the numbers start to go up when this really took hold, roughly March 17th. I could tell you that we are still what I would consider in very good shape in terms of resources, but we plan for it literally every day. If I told you how many phone conferences I had in the last 24 hours, I'd be lying, because I literally, Terry Monahan is sick of hearing from me, Rodney Harrison, the entire executive staff.
Let's be clear. Terry Monahan is not sick. He's just sick of hearing.
Yes, that's good. So we are not at the point where we're close to going to 12-hour tours. What we are doing, though, is planning for all eventualities and moving people from units that are less important right now to, you know, be ready for any and all eventualities. So I think that we are in a good place still, and the planning is literally ongoing hour by hour.
The other thing I just, before Ashley follows on, I just want to say is, again, as we've heard from Dr. Barbeau, a typical younger, and this is, again, most PD officers, younger person,
Healthy.
20s, 30s, 40s, healthy person, their experience with this disease will be something like 7 to 10 days, and it will not be a fun 7 to 10 days, but at the end of that 7 to 10 days, they will be right back in uniform, right back at their post. So this is a number that goes up, but will have an element that starts to go right back down from that original group that got sick. A lot of them will come back online. We'll be going through this for weeks and months. I don't want any misimpression that a person who contracts coronavirus is, you know, not coming back to work. They are coming back to work in the vast majority of cases, and soon. And we got to keep that in our calculations and in our planning. And obviously, we're very happy that most people are going to have a mild experience.
Yeah, I could tell you, Ashley, and if I miss one point, I'll circle back to you at the end. I could tell you that we've had people come back to work that had been put on quarantine, and I am really looking forward to when those people that are out sick with this virus come back to work for the obvious reasons. But I think, again, we're in good shape. Of the now 98, I think there's 3 that remain hospitalized, and that's including one that was discharged today, so that brings it to 3, and that's with pneumonia-like symptoms. I think I mentioned that the other day. So the vast majority, 95 of 98, are recovering at home.
But for those officers who've had contact with the public, is the NYPD tracking that, and are you telling members of the public that they've had contact with an officer who has now been confirmed to have COVID?
You're talking post?
Post come once the officer tests positive, are you going back and telling members of the public who they've interacted with in the course of doing their job that they have interacted with them? Do you have numbers on that?
No, I don't, and we'll take a look at that with legal. Obviously, you run into some HIPAA issues and things of that nature.
I go beyond it, and I'll pass to the Commissioner. I think we are at such an advanced stage in this crisis, but for a very particular situation where we thought, where our health people thought it was important to do that follow-through. I think the honest truth, Ashley, is we're in a new reality here where that generally is not going to be doable, nor is it necessarily going to make much sense. And I think the Commissioner is going to follow this on because of the sheer spread that we're experiencing overall.
Right. As I've been saying for the past couple of days, which feels like the past couple of weeks, we do have widespread community transmission. So that means that it's very likely that a large number of people are already exposed, and there is no real way to track down back to the point source. The other thing I want to just emphasize is that even though we are learning more and more about how this virus is transmitted, we still don't think that just casual contact, passing someone in the street, is going to infect folks, right? We're asking people to remain 6 feet apart because that's the general distance that a good, healthy, strong cough or sneeze has to get from one person to the other. And so I just want to remind us of the basics. And it's not just passing someone in the street. It's not even limited contact. It goes back to those basics. And so while the tendency may be to want to let everybody know who it is that they may have contacts with, that may have had contact with yet another contact, that kind of becomes irrelevant when we've got widespread community transmission. And that's why I have been so, dare I say, militant about having New Yorkers stay indoors.
Amen. Okay, who's up?
Dr. Katz's issues have been resolved. Dr. Katz, can you hear us?
Yeah, sorry, I could hear you always, but I had a technical problem.
All right.
Thanks so much for the question. With Jacoby, we switched.
Wait, is Amanda, hold on, is Amanda back on the line? I'm sorry, Dr. Katz. Is Amanda back?
Yes.
Okay. Yes?
Amanda, we changed the method of testing from more of a walk-by or drive-by model at Jacoby. It will reopen tomorrow to relieve the emergency department, which is consistent with what the mayor says, that we need to focus our testing on those people who are most sick and help to decompress the emergency rooms where people are coming with mild symptoms. We need to focus our attention on those people who are sickest.
Dr. Katz, I'm hoping you're feeling okay and getting some sleep. Is this transition going to happen across all health and hospitals facilities, or are we starting at Jacoby only?
Thank you, Amanda. All of our hospitals will have a tent outside as a way to decompress our emergency rooms. Several of them already have it. I visited the tent that was at Elmhurst and the tent that was already at Lincoln. Jacoby had the other model, and that's changing to the tent outside of the emergency room for this week coming.
Okay, great. Thank you very much.
Thank you.
Thank you. We have Craig from the Post.
How are you today? The unions have been calling for additional testing for fire, EMS, and NYPD. I was wondering, since these are the guys on the front line, they're going in there, getting people out of parks. Is there going to be any plan to maybe do expedited testing for them if they're concerned that they have coronavirus, since they're out in the streets?
I'll start, and my colleagues will join in. Again, the entire testing system is based on the priority needs. There's a priority given, of course, to protecting our healthcare workers and our first responders, but that's done still according to the healthcare priorities overall. If someone is young and healthy and has symptoms, there's many, many cases where they're just going to ride it out and they're going to be well and they're going to come back. If after those 3 or 4 days we're not seeing them get better, that's a different discussion. But it's about a priority structure that we have to remember that the testing has to be there to protect the people in greatest danger. You want to speak to that, Commissioner?
Certainly, I think to the extent that they fall into the prioritization categories of being over 50, having one of the chronic underlying illnesses, being sick, not getting better, and having their doctor determine that knowing the test status is going to change the course of therapy, then of course we would want to test them. But the basic message of if you're sick, stay home for at least 7 days since your symptom onset, or 3 days after your fever has gone away, whichever is longer, will continue to apply.
Okay. Who's next?
Next, we have Katie.
Hi,
Who's that?
can you hear
I'm
me?
sorry. Who is it?
Mayor, can you hear me, Mayor?
Yep. Go ahead, Katie. How you doing?
I'm great. How are you? I'm calling to ask if the city's discussed if there might be any changes to property taxes, which are due in April.
At this point, and we'll obviously be looking at everything, Katie, but we are in a really tough situation right now in this city, and I need to be very plain with New Yorkers about this. In the Congress as we speak, there is a real discussion going on. This is directly responsive to your question. There's a real discussion going on about relief for states, counties, and cities, direct relief, to the tune of hundreds of billions of dollars. Because right now, all local governments are just hemorrhaging money and dealing with massive new challenges and plummeting revenue. An example, I believe this estimate is right from our OMB. When the president canceled or postponed, I should say, income tax payments, that immediately took about $1.7 billion of revenue away from New York City at the height of the coronavirus crisis. That's a massive amount of money to have taken out of our hands just when we need it the most. So revenue is being stressed very, very deeply. Expenses are skyrocketing. We have a lot of tough choices ahead. I'll certainly consider all options, but it is not my instinct to take away other forms of revenue because we literally will not be able to pay for basic services. Now, if we get a massive direct federal stimulus, and I know Senator Schumer and Senator Gillibrand have been fighting for that very hard. I spoke to both of them yesterday. If we get that support, if it's really showing up quickly, that will affect our thinking, that will affect the equation. But I've heard in the course of today that unfortunately Republicans in the Senate are trying to remove any form of direct support for cities, states, and counties, which makes no sense in the middle of the biggest national crisis since the Great Depression, and that's going to hurt red states and blue states alike. It makes no sense. We need that support. We need the hundreds of billions for localities and for hospitals, also hundreds of billions, to be able to keep everything going. We have no guarantees of if and when and how that's going to happen. So the answer to your question is certainly I'm not ready to say that today. I don't think that's something we're going to want to do, but we're going to look at everything.
Next up, we have Gersh.
Mr. Mayor? Can
Hello?
you hear me?
Yep,
Yes, Mr. Mayor, can you hear me?
I can.
I promise you no unauthorized dinging today. I've turned off my notifications.
Excellent.
So you mentioned 10,000 new placards for healthcare workers, and as you know, most New Yorkers will completely agree on the need to help essential healthcare workers do their jobs. But doesn't this emergency order actually reveal how completely unnecessary the vast majority of the city's other 150,000 placards are? Because those are, after all, in most cases, just a job perk.
Gersh, it's a fair question, but honestly not a question for today. We've talked plenty of times about the need to change the approach to placards. I believe that it not only needs to be fundamentally changed, it will be as we bring on automated enforcement systems. And we're going to be very quick to take placards away from those who abuse. And I think we're going to have the greatest ability to know that in the next year or so that we've ever had in the history of the city. But right now, that's bluntly a secondary issue. This is about making sure that people who are desperately needed can get where they need to go. They're working very long hours. This is an emergency measure that we need to do. We'll deal with the rest of that when we get back to normalcy.
All right, thank you, Mr. Mayor.
Thank you.
Next, we have Jeff Mays.
Everyone's well. Mr. Mayor, I wanted to ask, the governor painted a very different picture of what he saw yesterday in New York City when he drove around. He was very frustrated and talked about how there were a lot of people out, a lot of people in the parks, but that's very different than the picture that yourself and the commissioner painted just now. What's the difference there? Why is the governor seeing one thing, but you guys are seeing something different?
Well, look, first of all, people can be at different places at different times, Jeff, and see different things. I think there's a tremendous consistency in the sense that we all are looking for where we think there's a problem or lack of adherence. When we see it, we don't like it, we're going to deal with it. And we all agree that's not most people. In fact, I think the governor's frustration was directed at the few who were being disrespectful of others, not at the vast majority who are following the rules. But again, I spoke to the governor today in detail, and I'm confident that in that conversation we aligned fully. We're going to have a strong enforcement apparatus from the finest law enforcement organization in the world, and I am certain it's going to be very, very effective. And, you know, I think there's going to be a certain amount of pressure from fellow New Yorkers, too. I think the point that you heard from my colleagues about people, like literally, I think you said cutting people a wide berth, and we were talking about the ways people are adjusting and changing. I'm seeing it 100%. Folks used to just walk by each other. They're now like stopping, figuring out who goes first. You know, is there enough room to have your 6 feet? That's only going to deepen. We're about to really feel the change in our lives with this new rule in effect. And so many people home, I think it's going to really jolt people's consciousness. And this is the beginning of the crisis. I've been blunt. It's going to get a lot worse before it gets better. So Governor and I are aligned. And we're going to say to anyone who's not getting the message, we're going to help them get the message. And then, obviously, I believe people will start to fall in line even more deeply.
Just another follow-up. Do you know what's happening to the prisoners that are being released? Are they being monitored, where they're going? And then, quickly, have you still been in contact with federal officials? You mentioned earlier this week you have spoken to Dr. Fauci and the Joint Chiefs of Staff, Chairman. Have you had further conversations with federal officials?
Yeah, I just want, I'll answer, Jeff, but I want to, again, in the name of rationing as we do these calls, I think we're saying to people, try and keep it to 2 areas, and please try not to do multiple run on many topics at once, because I think we want to make sure it's fair to everyone else. I spoke to the Veterans Affairs Secretary yesterday. I am trying to reach Vice President Pence. I am trying to reach the FEMA director. I know my team has spoken to the FEMA director. This will be ongoing. I've spoken to Senator Schumer almost every day. Spoke to Senator Gillibrand yesterday. This will be ongoing. I've spoken to Dr. Fauci a number of times. Again, what I'm looking for is the big answers on what will be delivered to us. On the question of folks who are released from our jail system, there will be monitoring for sure. There will be individualized monitoring and follow-up and supervision. Who's next?
Next up is Marina from AP.
Marina?
Hello. I was wondering about the what the conditions are at the local city hospitals. We're seeing some videos on social media of patients in masks lying on the floor because there are no beds. Is that real?
Mitch, are you on the line still? Dr. Mitch Katz?
I am on the line, sir. Masks lying on the beds? I don't understand that.
We're seeing video of patients we're seeing videos on social media of patients who are wearing masks lying on the floor because there are no beds. Is that real? Is that fake?
You mean
have
the
you been seeing those
patients
videos
that,
at all?
I'm sorry, Marina, just to clarify, you're saying patients who instead of being in a bed or a stretcher are on the floor?
Yes.
Okay, I have not heard that previously. Mitch, what have you heard?
No, it is not true. There are no sick patients lying on the floor at any of our hospitals.
And if you have details, Marina, we want them. If there's any place where something's not being done right, we want to know about it. There's definitely some real stress now on our public hospitals. I've been very blunt about the fact that the next 10 days are going to get harder and harder, and we desperately need resupply. But we welcome from our colleagues in the media, if you have a specific situation, which might mean, honestly, there's something wrong at a particular place, a particular moment that needs to be addressed by management, please get us those specifics, even if you want to do it confidentially, so we can follow up and help people.
And are you aware of any nursing homes or who are experiencing any sort of a high number of cases like the retirement community on Long Island? Are there any plans to test everyone who's working or a resident of a nursing home?
I'll turn to Dr. Barbeau. I mean, the primary regulation of nursing homes is by the state. And obviously, there's a lot of division of labor going on right now with so much to do. But Dr. Barbeau does try and stay in regular touch with the state health commissioner, Dr. Zucker. On this question, are you hearing about any particular areas of concern with the city nursing homes?
So we are in close coordination with the state, excuse me, close coordination with the state on nursing homes. And prior to the start of this, the upscale in this outbreak, we had actually sent out a number of surgical masks to the nursing homes in anticipation of increasing cases. And to my knowledge, there aren't any ongoing outbreaks. But again, things are moving very quickly. They're always in flux. And my staff and the state staff are working closely to ensure that we are especially vigilant with nursing homes, long-term care facilities. The governor has restricted access to those facilities, again, trying to minimize the number of individuals who may show up to them who are symptomatic.
Next, we have Mark Morales from CNN.
Hey guys, how you doing?
Good. How you doing?
Good, good. So I had a couple of questions. The first was in regards to the testing centers in Manhattan. Why were they canceled, and what's the status of what FEMA is doing?
So let's see. That I want to make sure we're getting the right person on this one. We're not talking about health and hospitals. You're talking about the work that we're now going to be doing with FEMA for testing. Is that right?
Right, right, and the location that was going to be there in Manhattan.
Right. So I think that Deanne Criswell, I believe, is on the line, our emergency management commissioner. Deanne, do you want to speak to? And Deanne, I want to remind everyone, served. She's done many things in her life: firefighter, Air Force officer, but also served at FEMA. So she's quite familiar with how to coordinate with them. Deanne, can you speak to that situation?
Yes, I absolutely can. So FEMA did provide some testing equipment and personal protective equipment, and we were originally going to set up 5 separate drive-through sites. Right now, in an effort to utilize the limited resources that we have while still expanding the city's overall testing capacity, we are going to be co-locating these testing sites now with our health and hospitals locations, so we can maximize their use in those locations while making the best use of some of the personal protective equipment that is in really limited supply.
Yeah, and Mark, I want to emphasize it's so painful to think of the greatest city in the world with the greatest healthcare organizations, the greatest professionals on earth. I mean, we are so blessed, but if you don't have equipment and you don't have supplies, it's a whole different ballgame. And we all know that when we really needed the testing, when it could have been absolutely strategically crucial, we didn't have it. And now we're at a point where we have to treat testing on a priority basis, given this massive community spread. But even that has to now be thought about in terms of the supplies and the equipment needed even just to keep the testing going as much as we want, because the first obligation is to save human lives. And when we're having to wonder, are there going to be enough masks, for example, for medical personnel, first responders, for everyone who's at the front line saving lives, it gets more and more complex by the day, the considerations that all of our healthcare and emergency management professionals are making with, no guarantees of resupply and supplies dwindling constantly. I said originally, I thought the thing we needed to worry about was the first or second week of April. I unfortunately can't say that anymore. Right now, even getting through the month of March is getting harder. Certainly, we expect tremendous difficulties in the first week of April if we don't get resupplied. So everything is changing by the day in our calculations, and it all comes down to if we don't start to change that supply situation, if we don't get the help we deserve, we're going to have to make even more challenging decisions.
The other question I had was in regards to Rikers. It's about those two dormitories, about the inmates who were inside who are not going outside of their dormitories, and I think they're refusing meals. What's being done about that? What are the conditions there? And can you give more specifics as to the monitoring process of inmates when they're going to be released?
We'll get you more on the monitoring. We are obviously creating this approach as we go along, but it's based on some of the other work that we do with supervised release, so we'll get you details on that. In terms of the situation on Rikers, we again don't have confirmation of the specifics, so don't want to comment until we do have confirmation. Our job is to protect everyone. There's a lot of extraordinary professionals who provide correctional health on Rikers and other facilities. Obviously, our corrections officers who protect everyone. And we look, the one positive X factor here is compared to 6 years ago, we literally have half the population in our jail system we had 6 years ago. We used to be around 11,000 plus, and now we're between 5,000 and 5,500. And we do think we'll be in a position very soon to start acting on hundreds of releases. But this is being created very, very urgently, and also in a way we've never had to do before. And so there's a lot being worked through. We'll have more to say on all of that, in the coming hours as we have more detail.
Next, we have Rosa.
Who is it?
Rosa from the city.
Thank you.
Hi, Mr. Mayor. How you doing?
Good.
Good. So I'm hearing from construction workers who don't understand why they're still building luxury condos and offices. They're cramming into an elevator to go up 50 stories to work on a luxury condo right now. And they want to know why the DOB is not shutting down sites, including sites with reported positive cases. Why should construction on these sites, these kind of sites, be continuing? Why aren't you instructing DOB to shut down building on sites like that?
Rosa, we are working within the parameters of the state emergency order. This is something I know, like every other piece of the equation, that's being constantly assessed. And I care about the safety of those construction workers, and I want to be very clear. If any construction worker is sick, they should stay home. If anyone gets sick on the job, they need to get immediately home, or if it's something urgent, of course, to care. But right now, the state guidance, and this is true in California to the best of my understanding, it was certainly true in San Francisco, but the guidance was to continue that work because it is outdoors, because clearly any part of the economy can still allow people to have a livelihood. That's so important as we see so many other people losing their livelihood. And because a lot of what is constructed obviously is crucial to our future. You and I would agree that luxury condos are not the priority in this city. But there's a lot of other things being worked on that are important because we will come out of this crisis and we will be playing the long game, as Commissioner Shea said. So as I understand it, that is the state guidance at this moment, and I believe it is the same in California. But it's something we're going to monitor all the time. And if there's specific sites we don't think are safe for specific reasons, we always retain the right to act on those. If there's any particular site you know of, we want to understand that so we can do follow-up inspections right away.
Yeah, I do, and I've passed them on to DOB, but just to follow up, I understand that the state does not make any differentiation between essential construction that, it supports infrastructure and things that are, like I've referred to, the offices, the condos, I've talked to people who are outfitting corporate offices right now, like that are totally empty, the insides of them. I mean, do you personally think that there should be some differentiation here?
Rosa, I want whatever's going to keep people safe. And I'm also concerned simultaneously, obviously, that anyone who can keep making a living within the parameters of the state pause order, that is still has value. So I am moved by your question to say we need to look at any individual situation that might need to be treated differently. And I certainly think it's a very important conversation for us to have with the state about whether we want to think about differentiation by type of construction. But I'm not offering personal opinions in the middle of a crisis. I'm hearing your question. I think it's a fair question. Best way for us to handle this is to have a real conversation with the state and get us all aligned on how we want to handle this for this coming week. But Rose, I'll say to you and all your colleagues, any rule, any approach, could change by the week, by the day, depending on changing conditions.
Next, we have Shant from the Daily News.
Yeah, thanks for taking my question, Mayor. I just wanted to go back to the possibility of closing some streets to vehicular traffic. Are there any details under consideration at this time, like the number of blocks or which parts of the city would be involved that you can share at this time?
I think some people, I believe Speaker Johnson's one of them, have said, look at the model from the Summer Streets program and, consider that as an option. I think that's a helpful example of something to look at. But I want to emphasize, Sean, we are not acting yet on that. I wish I could describe to you what we are all doing in terms of the day-to-day, hour-to-hour, constant decision-making, constant adjustment. It feels like our lives are one endless conference call these last days. But I say that only to say this point. We are constantly making changes and updates. So what I'm being blunt about is here's how we're starting this coming week. We're starting this coming week with a focus on parks and playgrounds. That's where you go, and streets are open as normal. We're going to see how that goes. We're going to see how enforcement goes. We're going to see how many people come out and how they handle it. If we think it's smart to open up some alternatives, we're only going to do that when we have a clear plan and we have clear enforcement in place. The last thing I want to do is create new places for people to congregate with no enforcement. That would be absolutely contradictory to the state order. So one thing at a time. We do not have a specific plan for those streets yet. I want to affirm that. There is no specific plan. There is no order that's been given, but we are going to consider it.
Got it. And just briefly, can you say who is kind of scrutinizing everything right now? I take it it's your office, DOT. Is city council involved? Can you say who the players are?
Yeah, I mean, since all of this is kind of run and gun, obviously, because we're dealing with an ever-changing crisis, we're going to work with the city council. They've had a lot of good ideas. We want to hear with them, and they understand their communities. We're going to work with DOT, of course. I think Parks obviously has a lot to say, but I'm going to really say Health Commissioner and Police Commissioner are going to be the first stops on that discussion, because why would we open those streets? Only if we thought it would not endanger people, obviously, so we have to solve for the negative first. If we think opening up more, or I should say closing off streets and opening up those spaces for recreation would create danger, we're not going to do it. Plain and simple. We're not going to do it if we think it's going to be a net negative. If we think it might be a positive, we still need an enforcement mechanism. So that's how we're going to start the discussion. You've heard some of the others who'll be in it, but I am emphasizing, I want to be crystal clear. Not happening unless I say it's happening, and we're going to be working closely with the state to align strategies. So I want to be really careful in a crisis that an idea is out there. If an idea is out there that I think is absolutely unworkable, I'll say, period, we're not doing that. Or we're not doing that, in the foreseeable future. If an idea is a good and interesting idea like this one, I'll say we're going to consider it. But I don't want people turning "we'll consider it" into, oh, this is definitely going to happen, because a lot of stuff's not going to happen in this kind of environment, or we may like an idea but may turn out to be not workable, where we have really sharp health and safety imperatives that we have to meet. So definitely will be considered. Stay tuned, but not happening now.
Next up, we have Shayna from the Washington Post.
Hi. So recognizing that the strategy is to provide tests on a priority basis, has there been thought to testing frontline city workers, NYPD, FDNY, also I guess private EMS, who are non-symptomatic, with the idea that you could take them out of circulation and avoid spreading the virus throughout their ranks?
I think, again, I suspect what the commissioner is about to say is community spread. And again, the whole reorientation we've had to go through with a changing reality with how pervasive this disease is becoming. But Commissioner Barbeau.
Right, so the recommendation would be the same. We're not going to be testing asymptomatic individuals. Individuals who are symptomatic, we want to make sure that they take themselves out of excuse me, out of circulation as quickly as possible. The reality is that the best way to avoid propagating the illness is to ensure that symptomatic individuals stay home, limit their outside contact to only the most essential activities. If they have someone who can go out for them to get food, medicine, etc., that's the best thing. Reminding individuals that 80% of the folks who do develop symptoms will have mild symptoms, and that usually within about 7 to 10 days, those symptoms will resolve. We want people to then come back to work 7 days after onset of symptoms, 3 days after their fever has gone, whichever is longest. But the most important thing is for symptomatic individuals to stay out of circulation, whether or not they are first responders, because the reality is that when we've got widespread community transmission, it's implicit that anybody you can come in contact with who is not one of your household members, you have to assume that they are symptomatic, and that's why we want to make sure that people stay at least 6 feet apart.
Shana, I'd also say, we're still in a situation of tremendous scarcity with testing. If that situation changed profoundly, we'd look at, again, I don't think it'll ever have the same strategic impact it would have, a month or more ago. But I think it's a common sense point, and Commissioner can speak to this, that, if you had endless testing capacity, you still have the challenge that negative today could be a positive tomorrow. And I think the symptoms, at least I believe, Commissioner, this is what our healthcare leadership believe, since the jury's still out on asymptomatic transfer, the symptomatic people are the folks that we know for sure there's a concern, much greater likelihood of spread. And that is dispositive. If someone's symptomatic, they're symptomatic. I mean, that's something we know tangibly in a way that even testing might not give us the clearest picture. I'm trying as a layman.
Right. No, I think that's a good point. I think for the foreseeable future, I don't see a scenario where we get real-time results back. And so any delay in someone taking themselves out of circulation then unnecessarily exposes other individuals to potentially contracting the illness.
Whereas symptoms are visible and immediate, and you know what you're
Exactly.
dealing with.
Yep.
It's kind of common sense. Go ahead.
Next, we have Sydney from Gothamist.
Hey, can you guys hear me?
Yep.
Great. Sydney with Gothamist. So just going back to the releasing people from city jails that I know a few people have touched on here. You said that you've identified another 200 that you hope to release. And so I know that the Board of Correction has identified hundreds of people who are older than 50 with underlying health conditions in jail for technical reasons. But 551 of those are in DOC custody, serving a city sentence of 1 year or less, or under 1 year for low-level offenses. And my understanding is that they've called on you as a mayor to use your executive power to release those people. That's 551. So where are you getting the 200 number from? And could you elaborate a little bit on how many people you hope to be able to release beyond those 200?
Sydney, no. I'm going to be straightforward with you. We do not have a magic number at this point. This is something we've never dealt with before. And Commissioner Shea, First Deputy Mayor Houlihan, his Chief of Staff, Freya Reel, Liz Glazer, our Director of Office of Criminal Justice, we're all trying to create a new approach here from scratch. We're all talking rapidly, constantly trying to figure this out. There is not a perfect target number. The Board of Corrections letter gave one interpretation of reality. I respect the board, but I don't think it was the most complete explanation of what's really going on. Within each of those categories, there are real variations and real differences from inmate to inmate in terms of criminal record and other factors. So it's just not bluntly as simple as that letter portrays. The group of 200 is the next pool, if you will, of people we are considering. I am not saying we're going to release X amount or Y amount. I'm saying we have 200 we're looking at right now that we're going to decide by tomorrow, and then it's just going to be constantly rolling. But we have to do, I think it's a very complex equation because we need the right kind of monitoring and supervision. We have to make sure that's there. We need to ensure that people we're releasing, we feel relative comfort, are not likely to reoffend or do serious crimes, because we have to balance all of the factors here. And the health conditions of people, absolutely crucial factor. But there's a deep concern that we not create a situation that we are uncomfortable with in terms of the ability to know what the outcomes will be, because you don't want to create a new problem trying to solve an original problem. And we have to take the public safety elements into account. It's very thorny, but one thing we know is we have to move quickly, and we will.
Okay, and so just to follow up on that, the latest understanding I have is that there are 38 people who tested positive for the virus in city jails. That's a combination of staff and detainees. And so I'm wondering, do you know the extent of the spread that is already existing in city jails? And do you know across which city jails that is? Is it beyond Rikers?
I don't have that in front of me. I don't know if the Commissioner Barbeau knows if it's just Rikers or beyond Rikers. I think you've answered the point. Obviously, numerically, we know the number of people who have tested positive. And we know, obviously, as with the whole city, there are going to be some people who have not yet shown symptoms but are positive. But we don't have a perfect model for this. We know it's an urgent matter by definition, just the nature of incarceration. So this is, again, it's a tough equation we have to work through very, very quickly. But we're all working together to get these answers and make decisions quickly, particularly for folks, anyone we think there's a particular medical vulnerability, that will be the front of the line.
We don't have information about whether it's Rikers or beyond, but we can get back to you on that.
Last up for today, we have Yoav.
Hey, Mr. Mayor. I wanted to ask 2 questions about the testing priority. One of them is just based on the number of confirmed cases, the percentage of people under 50 who have been confirmed. It comprises 56% of the confirmations. I'm trying to understand, given the criteria for getting tested, how so many people under 50 would have even been tested at this point, because I thought the initial criteria was being over 50 with preconditions, and now it's largely people who are either hospitalized or might require hospitalizations, if I got that correct. So, yeah, I guess why would so many people under 50 have been tested at this point?
I'll start, and I'll turn to Commissioner Barbeau. Yoav, I think, you've seen it that in the course of the last few weeks, we've been rapidly evolving and changing from a situation where it seems like a very quaint time long ago, but it was only a few weeks ago, where we were still trying to get testing in when it could have had a more strategic impact. And, we would talk about, a handful of cases in a day. I think it's fair to say that the testing prioritization has changed radically over the last days in particular. And remember that a lot of folks early on were getting testing, from different parts of our community without that prioritization. So I think that's part of it. What we're seeing again on the difference between who's been tested versus who's been hospitalized is striking. And obviously who is in most danger in terms of, preserving their lives. The fact that 35% of the hospitalizations are folks over 70, more than 3 times the representation of that group in the population. The fact that we've seen no deaths in people between 0 and, birth, I should say, and 44 years old. It keeps confirming that we need to shift as much of our focus as humanly possible to protecting folks who are older and have those pre-existing conditions. Now, I'll say it, and the commissioner will say it better than me. There are people under 50 with pre-existing conditions that we clearly are concerned about, and that's a group of people that obviously there are situations where they absolutely need to be tested. But I think the answer is that where we started, a few weeks ago versus where we are now, it's a much tighter prioritization now, and I think as you see testing levels going forward, they will follow that prioritization more and more.
I think that's right, Mr. Mayor. We, through the course of the changing nature of this outbreak, have been adapting, if you will, to the changes that came down from the CDC in terms of testing recommendations. I think that there are a lot of people who in the early period were getting the message, get tested, get tested. We're trying to change not only provider behavior, but also New Yorker behavior, and having people feel comfortable with the fact that as we are in a greater proportion of people having COVID-19, meaning widespread community transmission, that the importance of being tested goes down ever more unless you are in one of those priority categories. And even though we've said, greater than 50 with those 5 pre-existing conditions, I think the reality is that there are many New Yorkers who may be less than 50 and have those chronic conditions. So I think what we're seeing is a shift in changing behavior between New Yorkers, providers, and the availability of testing. And so my hope is, and we're trying to put measures in place, that over time we will see an increase in testing of older individuals and a decrease in that younger age group. Though certainly it is up to provider discretion if they have patients they feel are not getting better. Because again, we don't want to completely discourage people from getting tested if indeed they are not getting better after 3 or 4 days of being home sick.
Okay, thank you. And just along the same lines real quickly, there was a photo by my colleague, David Goodman, our colleague, I guess I should say, outside of Elmhurst Hospital of people waiting to get tested at the tent. And it looks like there's a good 50 to 80 people out there and standing in line. And this was after the change that focused on testing the folks who are hospitalized or kind of severely ill who might require hospitalization. So I guess my question is, am I to assume that everyone out there, meets that criteria? And if so, I guess I'm just wondering if that is the best method to test people who might be severely ill.
Yoav, let me jump in on that, and then Dr. Katz. It's a very good question. I don't, we're trying our damnedest to take an immense amount of information and make it clear. And sometimes I think we don't fill in the blanks as well as we need to. So I'm glad you raised this. But I think we've said it in press conferences, but not nailed it really as clearly as it needs to be. Priority people, that means, folks who were really worried about their fundamental health and their potential, obviously, of severe ramifications. That's not, generally speaking, folks who are younger and healthier, but folks who could easily end up hospitalized or, God forbid, even in danger for their lives. That's one of the priorities for testing. But the other thing that we've said over recent press conferences is to relieve pressure on emergency rooms appropriately, where people are coming in with specific situations, that are worthy and need to be addressed, and we're trying not to let the emergency room be overloaded. We have the folks outside emergency rooms who are turning away folks who do not need to be there at all, or diverting them to another location where they should be, but also the testing capacity to protect the emergency room's ability to serve people who need it most. So Mitch will speak to that, but I also want to note to Mitch and to everyone, even in a situation like that where we're trying to make sure we're serving people, if the wrong kind of lines develop, and this is something Dermot and I have spoken about, we understand there will be lines some places in New York City if folks are waiting to go to a grocery store or pharmacy in some places or to get tested. Lines need social distancing. We don't like lines at all. I think Dr. Barbeau does not like any kind of line, but if you have a legitimate line, we need social distancing in the line. And there may be times when PD, for example, says about something, we don't think this is a smart way to do this line, and we want people to go away and come back later. There's different ways we'll deal with it. But for that specific situation, let's presume our friends at Health and Hospitals would be very careful to do line management. Mitch Katz, please explain for that line why folks there are being tested and how that fits with keeping your emergency room going.
Yes, sir. When we opened up the tent, we gave tremendous relief to the emergency department so that they could focus on the sickest patients. Those patients were previously coming forward. And of course, everyone has to be assessed because some people really do need to be emergency care. But the tent has allowed us to have them be mild illness to be assessed in a different place to not take up the emergency room time. I'll add that in that picture your colleague took, you'll notice that the people online are all wearing masks. And we give people who are standing on that line a mask in order to decrease the chance that they will cough or sneeze on anybody else. And of course, it's also much better for them to be online in the outside with the free air than sitting in a waiting room in a closed hospital.
Well said, Dr. Katz. With that, thank you, everyone. I hope we were able to share a lot of helpful information, and we will see you tomorrow. Thank you, everyone.